Thank you for the participants who have completed the pre-test. Now, let me read the participant rule. All participants are required to be on camera. All participants are not allowed to make noise during the seminar. During the presentation of the materials, participants should listen it carefully. During the discussion session, participants are allowed to ask questions using the microphone or from the chat field. Hopefully, all requirements can be followed by all participants. All blessed audience, the first agenda is opening. Let's start this agenda by reading Basmalah together. The second agenda is National Anthem of Indonesia Raya and March of Health Polytechnic of the Ministry of Health Tasikmalaya.
Indonesia
The third agenda is reading of the prayer. Turandi, time is yours.
Before we begin the event, let us take a moment to pray for the smooth proceedings. I will lead the prayer in accordance with Islamic tradition, and I kindly ask those of other faith to adjust according to their own belief and confession. Bismillahirrahmanirrahim. Innal hamdalillah nahmaduhu wa nasta'inuhu wa nastaghfiruh wa na'udzu billahi min syururi anfusina wa min sayyiati a'malina. May yahdillahu fala mudhillalah wa may yudlilhu fala hadiyalah. Allahumma shalli wa sallim ala sayyidina Muhammad wa ala ali sayyidina Muhammad. Amma ba'du. Rabbana hab lana min azwajina wa dzurriyyatina qurrata a'yun waj'alna lil muttaqina imama. Wa ajid innallaha taqwati wa natamu inna antum muslimun. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. Amin amin ya rabbal alamin. Wassalamualaikum warahmatullahi wabarakatuh.
The fourth agenda is speech. The first speech will be delivered by Chairman of the Medical Record and Health Information Student Association of the Ministry, Health of Tasikmalaya, Haikal Gibrani. Time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. The Honorable Rector of Health and Polytechnic Ministry of Health Tasikmalaya Department, Dr. Dini Mariani, Bachelor of Nursing, Nurse, Magister of Nursing, the Honorable Head of the Medical Record and Health Information Program of the Health Polytechnic of the Ministry Health Tasikmalaya, Mr. Andi Suhenda, Bachelor of Public Health, Magister of Public Health. The Honorable Speaker of Seminar, Ms. Nik Azliza Nik Arifin, Doctor of Philosophy, Utilization of Medical Record and Big Data Analyzing. The Honorable Speaker of Seminar, Prof. Emily Chia Yusu, Professor of Institute of Biomedical Informatics, National Yang Ming Chiao Tung University. The Honorable all lecturer and staff of Health and Polytechnic Ministry of Health Tasikmalaya Department, and the Honorable all participants from Indonesia, Malaysia, and Taiwan. First and foremost, let us express our gratitude to Allah Subhanahu wa Ta'ala. For His grace, we are all able to gather and participate in the 4th International Seminar of Medical Record and Health Information with the theme Electronic Medical Records, Medical Billing, and Big Data through the Zoom Cloud platform. The theme we have chosen is highly relevant in this digital era, where information technology plays a crucial role in encasing health service delivery. Electronic medical records, medical billing, and the utilization of big data are important and challenging topics, as well significant opportunities for all of us. On this occasion, I would like to extend my heartfelt appreciation to all the commit member and faculty who have worked diligently to make this international seminar a success. We also hope that participants can follow this event from beginning to end, so that they can gain the maximum benefit from each session presented. We hope this international seminar will serve as a beneficial platform for exchanging knowledge and experience in the field of medical records and health information, as well as opening opportunities for the future collaboration. That concludes my welcome speech. Thank you for your attention and participation. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you for the speech. The second speech will be delivered by Chief Executive of Seminar International Medical Record, Maudi Seila Majid. Time is yours. Assalamualaikum warahmatullahi wabarakatuh. The Honorable Rector of Health, Poltekkes Ministry of Health, Tasikmalaya Department, Dr. Dini Mariani, Bachelor of Nursing, Nurse, Magister of Nursing. The Honorable Head of the Medical Record and Health Information Program of the Health Polytechnic of the Ministry of Health, Tasikmalaya, Andi Suhenda, Bachelor of Public Health, Magister of Public Health. The Honorable Chairperson of the Medical Record and Health Information Student Association, Haikal Gibrani. The Honorable Speakers of Seminar, Nik Azaliza, Nik Arifin, Doctor of Philosophy, Utilization of Medical Record in Big Data Analyzing. The Honorable Speaker of Seminar, Prof. Emily Chiayusu, Professor of Institute of Biomedical Informatics, National Yang Ming Chiao Tung University. The Honorable All Rector and Staff of Health and Polytechnic Ministry of Health, Tasikmalaya Department. The Honorable all participants from Indonesia, Malaysia, and Taiwan. First, let us praise and gratitude to Allah Subhanahu wa Ta'ala,
who has bestowed His grace and blessings so that we can carry out this international seminar in good health. Salawat and salam may always be poured out to our guide, the Prophet Muhammad sallallahu alaihi wasallam, and may we be among those we get his intercession at the end of time. Amin ya rabbal alamin. I, as the chief executive of the international seminar activities organized by the Medical Record and Health Information Student Association, would like to thank you very much for the participation of all participants, which this event aims to increase the knowledge of medical record professionals and students regarding the competition, challenge, and opportunities of medical record and health information in the era implementing electronic medical record, or EMR. The theme of this seminar is electronic medical record, medical billing, and big data. This I can convey on behalf of the organizing committee. I thank you very much and apologize for the shortcomings. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you for the speech. The third speech will be delivered by Rector of Health and Poltekkes Ministry of Health Tasikmalaya Department, Dr. Dini Mariani, Bachelor of Nursing, Nurse, Magister of Nursing. To Dr. Dini Mariani, time is yours.
Okay, Bismillahirrahmanirrahim. Honorable Speaker, distinguished guests, colleagues, and participants. Assalamualaikum warahmatullahi wabarakatuh. Good morning and warm greetings to all of you. First and foremost, let us express our deepest gratitude to Allah Subhanahu wa Ta'ala for His endless blessing and guidance that have allowed us to gather here today for the fourth international seminar on medical record and health information. It is an honor for the Health Polytechnic of the Ministry of Health Tasikmalaya to host this event, bringing together experts and professionals from around the world. The theme of this year's seminar is both timely and vital to the future of healthcare, electronic medical record, and big data. As the healthcare industry continues to evolve, these two areas are revolutionizing how we manage health information, deliver care, and improve patient outcomes. Electronic medical record, or EMRs, have become a cornerstone of modern healthcare systems, offering an efficient and secure way to manage patient data. EMR not only reduce errors, but also improve the quality of care by ensuring that healthcare providers have immediate access to accurate and up-to-date patient information, of course. This transformation in data management allows for more seamless communication among healthcare teams and enhance decision-making, which ultimately benefit the patient. On the other hand, big data is playing an increasingly important role in shaping the future of healthcare. The ability to collect, analyze, and interpret vast amounts of data is opening new frontiers for research, patient care, and system optimization. With big data, we can better predict health trends, personalize treatments, and make data-driven decisions that lead to more efficient healthcare delivery. However, with these opportunities come challenges in data privacy, security, and ethical use, which we must address as we move forward. Today, we are privileged to have a distinguished lineup of speakers and experts who will provide valuable insight into this topic. Their knowledge and expertise will not only help us better understand the current landscape, but also inspire us to think creatively about how we can apply these tools and technologies to improve healthcare for all. I encourage everyone to actively engage in these discussions and share your ideas, as this seminar is not just a platform for learning, but also a space for collaboration, of course. Together, we can work towards innovative solutions that will shape the future of healthcare. I would like to take this opportunity to thank our organizing committee, sponsor, and partners for their dedication and hard work in making this event a reality. Your contributions are greatly appreciated. With that, I officially declare the 4th International Seminar on Medical Record and Health Information open. May we all benefit from the knowledge shared today, and may Allah guide us in our efforts to advance healthcare. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you for the speech. For all participants, before we start the international seminar, we have to documenting all of us who join the Seminter. Untuk semua partisipan, sebelum kita memulai seminar internasional, kita harus mendokumentasikan siapa saja yang mengikuti seminar, maka dari itu, maka akan kami mulai dokumentasinya. I will count from slide 1. 1, 2, 3. One, two, three. 1, 2. For the next slide, 1, 2, 3. And then the next slide, 1. For the third slide, 1, 2, 3. For the fourth, 1, 2, 3. And for the fifth slide, 1, 2, 3. Okay, thank you. Well, ladies and gentlemen, we're going to enter our main agenda, that is deliverables of materials from our speakers. This session will be led by our moderator, Ms. Diana Bersasela, Magister of Health, Doctor of Philosophy. Before that, let me introduce our moderator. There is a curriculum vitae of hers. Name, Diana Bersasela. Contact and social media person is attached. Education, attached. Job, Assistant Professor of Health Polytechnic of the Ministry of Health Tasikmalaya. Organization, International Center of Health Information Technology, College of Medical Science of Technology, Taipei Medical University, Taipei, Taiwan. Recent research and publication attached. Recent reviews attached. Recent international conference attached. To Miss Diana, the floor is yours.
Thank you, Aisha. Welcome, everyone. Thank you for joining us today. As we begin this important seminar, I would first like to express our gratitude to Allah for granting us the opportunity to gather today to explore the impactful subject. The Honorable Director of Health Polytechnic, the Ministry of Health Tasikmalaya, Dr. Dini Mariani, Bachelor of Nursing, Nurse, Magister of Nursing. The Honorable Head of the Medical Record and Health Information Program, Bapak Andi Suhenda, Bachelor of Public Health, Magister of Public Health, the Honorable Chairperson of Medical Record and Health Information Student Association, Haikal Gibrani, the Honorable Speaker of Seminar, Nik Aziza, Nik Arifin, Doctor of Philosophy, Utilization of Medical Record in Big Data Analyzing, the Honorable Speaker of Seminar, Professor Emily Chia Yusu, Professor of Institute of Biomedical Informatics, National Yang Ming Chiao Tung University, the Honorable all lecturer and staff of Health and Polytechnic Ministry of Health Tasikmalaya Department, the Honorable all participants from Indonesia, Malaysia, and Taiwan. May Allah guide us in our discussion and effort today, and may the insights shared help us make meaningful advancement in the field of healthcare analytics for the benefit of all. We are here to discuss about utilization of medical records in big data analysis. It's my great pleasure to introduce our distinguished speaker today, Nik Azliza Nik Arifin, PhD, who brings a wealth of knowledge and experience in the field of the healthcare data analytics. Okay. Nik Azliza Nik Arifin, PhD, is a senior lecturer from School of Information Science, College of Computing, Informatics, and Mathematics, University Teknologi Merah, Kampus Puncak Perdana, Malaysia. She has academic qualifications. She graduated the Bachelor Science from Human Science, Political Science from International University of Malaysia, and she got a Master of Science Information Management from University Teknologi Merah, UITM, and she also got her PhD from in Electronic Information and Record Management, the state-of-the-art of electronic medical records implementation in selected public hospitals in Malaysia, also from University Teknologi Merah, UITM. She is also a member of SARBICA, Southeast Asian Branch International Council on Archives, Persatuan Sejarah Lisan Malaysia, PSLM. And she has dedicated as a lectures for 25 years, and the current teaching is in Management of Records Repository, Managing Records in Organization, Management of Medical Records, Oral Documentation, Epidemiology of Information Management, Documentation of touched knowledge master's program, health policy and law in the Faculty of Medicine UITM and health information management. She also has so many, she joined so many conferences and training, yeah, attached. Okay, next. We see the current. Oh yeah, so many. Okay. So many international conference she joined. And then she also had so many research and did so many research, conducted so many research and published so many papers. Okay, attach. Please show the current or the last paper published. Previous. I want to see. We want to see the last published paper. Wait, no. Okay, and then also another jobs like the editor in the proceedings of a national seminar on management. Yeah, she has so many experiences, like a leader of the special interest group, electronic medical record system, reviewer, IBIMA, editor e-journal, sejarah lisan, and the person in charge bagi performance indicator, perancangan strategik, FPM, or MOU or MOA, and pensejarah jemputan bagi fakulti perubatan untuk kursus dalam Master in Medical Ethics and Law, and so many. Okay. Next. Next. Yeah, everything attached here. Okay, thank you. Without further ado, please join me in welcoming Nik Azliza Nik Arifin, PhD. Ibu Nik Azliza Nik Arifin.
Excuse me, miss.
Yeah, do you already join?
But I think the presenter may not join the Zoom. So now, before we're going to the materials, now we're going to watch a video of medical record and health information, Tasikmalaya Department, and then we continue to the materials when Nik Azliza is join the room. Please enjoy.
Selamat datang di Poltekkes Kemenkes Tasikmalaya, Prodi D3 REKAM MEDIS dan Informasi Kesehatan. Yuk kita kenalan. Selanjutnya, kita punya laboratorium, kode klinis, dan rekrutmen yang manual dan yang elektronik. Yuk kita lihat yang manualnya dulu. laporan rekam medis dan informasi kesehatan. Prodi kita memiliki banyak lab, salah satunya yaitu lab manual yang biasa digunakan praktek oleh mahasiswa rekam medis dan informasi kesehatan. Sebagai sumber pembelajaran, Prodi D3 Rekam Medis dan Informasi Kesehatan memiliki dosen yang berkualitas dan super kritis. Prodi D3 Rekam Medis dan Informasi Kesehatan juga punya seragam yang gak kalah keren. Yuk kita lihat.
Okay, I think Dr. Nick Azliza, Nick Arifin already joined the Zoom. Dr. Nick? Dr. Nick, are you already joining the Zoom?
Assalamualaikum ya, bisa dengar?
Bisa, ya.
Ya.
Okay, thank you so much. Without further ado, please join me in welcoming Nick Azliza, Nick Arifin, PhD. The time is yours for 60 minutes with the arrangement of 45 minutes for delivering a talk and 15 minutes for discussion. Okay? Please, Nick Azliza, Nick Arifin, PhD. The time is yours. Silakan Bu.
Ya, terima kasih ya Ibu Diana ya. Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi semua. Salam dari UiTM, salam dari Malaysia. Ya, semoga kita semua sihat-sihat ya, insyaAllah. Ya. So today I am so honored that being given a topic, one of my favorite topics actually, right? Ada juga artikel saya mengenai the role of big data in improving patient care, right? So terima kasih to all the organisers ya yang saya sentiasa berurusan, iaitu Maudi Sheila namanya ya. Anak Sheila ini sangat bagus ya, sangat kita adabnya, akhlaknya sangat bagus ya berurusan dengan saya. Terima kasih. Alright, so today my topic will be on utilization of medical records in big data analysis. Yeah. Okay, my name is Nik Azlizani Arifin. Right now, I'm a senior lecturer in School of Information Science, yeah, College of Computing, Informatics and Mathematics at University Technology Mara. Yeah. So let us look on the contents, right? Yeah. So you can see my picture there, right? Of course, and I'm live as well from Malaysia. Okay, the contents of this topic, right? The first one is introduction, right? We can look and we have the key application, utilization of medical records in big data analysis. We look also into issue and challenges and what are the future trends right now. And the last one is a conclusion. Right, yeah. I also provide some of the case studies that will be as an example to all students. Yeah. So itu lebih bermanfaat dan nampak lebih clear ya, certain points di situ ya. Alright. So talking about the introduction, okay, the next slide. Nowadays healthcare industry possesses a numerous volume of data. We have a lot of data. Right. Kenapa namanya big data? Ya? Bila sebut big data, maksudnya di sini ialah datanya terlampau besar, ya? Banyak begitu ya. So a numerous volume of data which are raw, right? Ada yang raw, ada yang unstructured, and clinically relevant to improve healthcare services, right? Basically, that it will be about of the big data. Yeah? These data include patient medical records, example, electronic health records, yeah? And then kita ada medical imaging, yeah? Di dalam hospital pelbagai data yang kita ada, ya? Medical research data, and many more. As healthcare information growing, the term big data seems to have some significant roles in helping to manage the large volume of data yang it has been set in the organization. Yeah. Okay, big data is large scale digital data, banyak dan dia dalam bentuk digital. Yeah. So what we can say that as the data come from numerous and variety of sources, it makes it more complex and different from the traditional use. Okay, yang mana traditional dalam bentuk paper, ya, right? Dan what we can say that how the software and the data processing, right, can provide a good data. Yeah? So the unique characteristic of big data compared to this traditional use of software, that is the ability, right? The words of ability, how they capture a large volume, right, of data from many sources and of course and from the many of data structures and nature, and its ability to provide real-time data. Maksudnya kita perlukan dalam bentuk yang urgent, ya. Okay, perlukan kita klik and data itu ada, ya. Alright. And then in the healthcare industry, digitizing of existing data and the creation of new forms of data in big bites, okay, big bites, ya. Size which is contribute to a lot of the data growth. Yeah. So worldwide healthcare data pada tahun 2012, pada tahun 2012, it is spotted that around 500 petabytes. Okay, and it is estimated to grow to 25,000 petabytes by the year 2020. And now it's growing and growing and growing. So data from the healthcare industry constitute from structured, unstructured, all right, or even semi-structured. Yeah. So the potential use of big data lies in its capability, whereby the variety of data sources. Yeah. So there is one study on 2012, Fieldman, Martin, and Scott Nurse, right? They mentioned that, okay, high velocity level, right, of big data perhaps could provide real time. What does it mean of velocity? Velocity maksudnya speed, speed, ya, yang mana that's why they said about real time data. Yeah? So at the rest or in motion for health analysis and improvement of care delivery, right? Yeah? So what we can say that the big data defined differently according to the perspective or disciplines of industries. Yeah? So according to Demaro, all right, it all suggested that big data in healthcare means information assets, all right, characterized by such high volume, velocity, and variety to require specific technology and analytical methods for transformation into value. Right. So there are certain big data at first, it only apply 3V. 3V means dimension, three, what we call that, values, right? What the three values, right? The first one, volume, variety, and velocity. That is the part, the first part of the three V's, yeah? And then after that, it continue to be, all right, until the 6 V's of big data, right? Okay. So let us look on this particular point of view, all right, okay? Cut it short, okay? Can you go to the previous slide, please? Previous, not the one, the introduction, that's one. Okay, before this. Okay, so what we can say that, all right, in short, in simple words, all right, the big data is defined as mass amount of data that may involve complex, unstructured data as well as semi-structured data, right? So the big data is data set that are so voluminous. Voluminous maksudnya banyak, ya, alright, and complex that traditional data processing application software are inadequate to deal with them, alright. So big data challenges include we can capture data, adanya data storage, data analysis, search, sharing, transfer, visualization, querying, updating, right, and information privacy. Okay, so what we can look here, okay, big data is a vast amount, heterogeneous, yeah, heterogeneous di situ. Okay, so the next slide, what we can look here, all right, is about the 6 V's of big data, right? Yeah? So the big data, as I told you just now, the values, all right, what are the 6 values here? The first one, all right, the 3V volume, okay, the amount of data from myriad sources, daripada pelbagai sources. Yeah? The second one, right, the types of data, structured, semi-structured, and unstructured. Right. Another V is velocity, the speed at which big data is generated. How speed, right? Okay, how fast the data that we can receive. So that is what we call velocity. All right. The next one, veracity. Right. Yeah? So what we can just now I mentioned to you is about the first part. All right. The 6 V's. That is the first thing. All right. They so called as big data. But right now we are growing and growing. So right now we have 6 V's. The V's itself. So the next V is veracity. So what does it mean of veracity? The degree to which big data can be trusted. Right, it means that, okay, how the data can be trusted, okay. And the next one, the value, right, the value of the data itself, right, the business value of the data collected, right. So what are the data that has been collected and how the value of that particular data, and is it the data is value to your department, is it the data value to the, what we can say that the organization. So this is about the 6 value. All right, yeah. The next, the 5th value. The next value is variability. All right, yeah? So the ways in which the big data can be used method. All right, yeah? So we have the data. The data have the value itself and how the data can be used and how the data can be formatted. All right, yeah. So the next one, how big is big data? We are calling the big data itself, right? The big data. And how big is big data? All right, yeah. So talking the next slide. All right, talking about this what we call how big is big data. All right, yeah. Next slide, please. Okay. So it is impossible to put a number, all right, on what quantifies big data. All right, we can understand that something impossible, right? Once we talk a big data, all right, okay, but it generally refers to figures around petabytes and exabytes, right? I hope that all of you can just Google, all right, what does it mean of petabytes and exabytes, and I think all of you knows what it's all about. So that is what we call, all right, the big data, and it falls under the petabytes and exabytes. Yeah, all right. It includes vast amount of data sources, all right, gathered from given company, all right, its customers, its channel partners and suppliers, as well as external data sources. So basically, all right, this is what we call, all right, the big data itself, right, is a vast amount, and what we can say that it gather, right, it come from various sources. If in hospital, all right, okay, we have many departments, we have many sources of information, so this is what we call big data. All right, yeah. So the next slide. Okay, this is about the astonishing growth of big data. What does it mean of astonishing? We can say that amazing, ya, menakjubkan begitu, ya. So in this situation, okay, as digitization is rapidly increasing, ya, so is the demand for big data, especially because of the sudden rise in the use of electronic devices. All right, for example, internet, okay, sensors, and we have also technology of capturing data from the world we live in, right? So data in itself is not something new, right? Dari dulu lagi kita sudah ada data, ya. So before computers and databases, we had paper. Jangan lupa sebelum datangnya komputer memang ada data tapi dalam bentuk traditional, iaitu paper, right? Yeah. So we are doing paper transaction records. All right, we have the patient, what we can say, report, yeah, archive file as data, databases. All right, spreadsheets and computers gave us a way to store and organize data on a large scale and an easily accessible way. Sama saja, kita simpan, tapi kita simpan right now in a new millennium dalam bentuk komputer, right? Dalam bentuk soft copy, dalam bentuk sistem, begitu, ya. Yeah? So in this case, right, yeah, that is just a tool. That's why we can say that computer is a tool that makes the instant availability of information at the click of a mouse. All right, it means that we keep the data, all right, into dalam system itself, all right, and we just want it, we just a click, all right, and the data, the information, all right, is appear, all right. So this is what we call the accessibility is much more easier, yeah. So the amount of data we are creating continuous is increase rapidly. Hari-hari datanya masuk. Sebegitu juga patient dalam hospital, hari-hari patient datang. Right? Ada yang new patient, ada yang old patient, right? Yeah? So that's why, right? What we can say that the data in the healthcare itself is growing rapidly. Yeah. So data is predicted to go from around 5 zettabytes today to more 50 zettabytes by 2025. Right. Yeah. So it is very easy to generate data today whenever we go online, right? When we carry out GPS-equipped smartphone, for example, right? And kita communicate with our friends on social media or even while we shop as well. So in another, what we can say, a very simple words, all right? We can say our every step is living in a digital footprint. Ya, okay, seperti sekarang ni sudah ada QR code. Bayar pun senang, transfer saja pakai QR code. So that is also part of it. Yeah? So as a result of this, the amount of machine-generated data is rapidly increasing too. So this is a part of what we can say. For example, all right, if you want to have some information, especially about the patient information, all right, we can retrieve easily. All right, the next slide, okay, the usage of big data. All right, yeah. So these are the top big data application that we can have a look. All right, next slide, please. All right, so we can see in this case, all right, a lot of big data application. Okay, next slide. Okay, so we have in travel, we have in education, we have in telecom, e-commerce, media and entertainment, retail, finance, and of course in healthcare. So these are the top big data applications, especially whereby we have so many, the large volume of data and how we handle the data. And of course, right, right now we are in a new millennium. Every one of us, all right, dealing with a lot of data. In fact, for us, for example, as a student, of course, we have another education whereby there is also we have a big data in education scope, and now we are talking about the healthcare. All right, so next slide. Why medical records are crucial in big data analysis? Right, yeah. So in this case, what we can have, we can look at medical records are a treasure trove of patient information, offering invaluable insight, especially for healthcare providers, researchers, and policymakers. Right, yeah. When they analyze using big data techniques, so these records can unlock a wealth of information. Banyak maksud di sini ialah we have a lot, okay, wealth means kaya gitu ya, banyak sangat maklumatnya that can improve patient care, enhance healthcare quality, and drive innovation in the field of medicine. So from all these kind of information that we have, all right, so we can get a significant, right, especially from this particular medical records, right? Okay, so next slide. So these are the some key reasons, all right, why medical records are so important in big data analysis. The first one is comprehensive patient information. All right, talking about this comprehensive patient information, I think all of you knows about what are those what patient information. The first one, okay, whereby we can look at the comprehensive means the medical records contain a vast area of data. All right, what kind of data? These are the data that we want to look at. The demographic, all right, the age, the gender, all right, and race, ethnicity, and socio-economic status, all right, yeah? And then the next one, we are looking also on the medical history, all right, the past diagnosis, for example, the treatments, and what are the procedures that has been involved by the patient, all right? And then we look also on the vital signs, yeah? So, example, blood pressure, all right, and then heart rate, temperature, and other physiological measurement, all right, yeah. So the next one, we look into a lab result, right, that is normally happen, all right, in the hospital. Also, for example, the blood test result, the urine test result, for example, all right, and other diagnostic test result, yeah. And then we look also, okay, on the part of um, sorry, yeah, okay, on the part of imaging studies, yeah. So on this part, example, X-rays, CT scans, MRIs, and ultrasound, yeah. And the last one is about the medication history. So usually on this particular information that we can receive is about the prescription, okay, and over-the-counter medication and supplements. So this is basically on the first point, comprehensive patient information. Right. The next point is longitudinal, all right, data. So what does it? It's about the medical records provide a longitudinal view of patient health over time. Yeah, allowing for the analysis of disease progression, right, treatment, how effective the treatment, for example, and the impact of the lifestyle factors. All right, yeah. So the next point is about population health insight. Yeah. So by analyzing large databases, right, and data sets of medical records, researchers can identify trends and patterns in disease occurrence, yeah, risk factors, and healthcare utilization at the population level. Right. Yeah? So The next one is research and development. Basically, talking about research and development, all right, we are looking on the 3 points here. The first thing is clinical trial, right? Yeah? So evaluate the safety and efficacy of new treatment, right? And then we look also into epidemiological study, right? Yeah? So this is basically we investigate the causes and risk factors of disease, right? And the last one is about the health services research. So this is basically assessing the quality and efficiency of healthcare delivery, right? Yeah. So the next point is about quality improvement and personalized medicine. Yeah. So on the quality improvement, basically we analyze medical records that can help identify areas for improvement, okay, especially in healthcare quality, right? And then we have like such reducing medical errors, right? It can improve the patient safety and enhance patient satisfaction, right? Yeah? Whereby on the personalized medicine, okay, basically by combining medical records with genetic information and other patient specific data, healthcare providers can develop especially the personalized, yeah, treatment plans, right, that are tailored to the individual needs for each patient, right? So we can say that these medical records are available resource for big data analysis, right? And it offers the potential to improve patient outcomes, all right, enhance the healthcare quality and drive innovation, all right, especially in the field of medicine, right? Yeah. So the next one we are looking on the next slide is about the benefits of big data analysis, yeah, in healthcare. So let us look on the general part itself. Yeah. Okay. The next slide. So we have a few benefits here. Right, next slide, please. All right. Yeah. So revolutionizing healthcare, the impact of a big data, right? Yeah. So this is about how this kind of benefits, all right, can give impact, all right, especially in the healthcare. All right. Next slide, please. Right, yeah. So the revolution of healthcare through big data has transformed the industry, right? And so it implies on the impact of data itself, right? And how this impact of data analytics on healthcare and its potential, all right, improve the patient outcomes and operational efficiency, right? Yeah. So next slide. So talking about big data in healthcare, all right, we can say that the utilization of big data in healthcare involve the collection and analysis of vast volumes, yeah, information from diverse sources, right? So this encompasses patient records, clinical trials, and medical imaging, all right? We have the enabling insights and drive innovation, and of course, decision making as well, right? So next. So on this revolution of the big, what we can say in healthcare, right? We are talking about the big data itself, right? So what are the benefits that we can gain, right, from this big data, right, in healthcare, right? So the first one we can look here, big data analysis has revolutionized the healthcare industry, all right, by provide valuable insights that can improve patient outcome, enhance healthcare quality, all right, and reduce costs. So these are the certain points that we can look, all right, and give something insight to all the students, all right. The first one is about the patient outcomes, all right. Yeah. So bear in your mind that, okay, so the big data has some advantages. So the first one is improve patient outcomes. Yeah. So what does it mean of improve patient outcomes? All right. Yeah. So talking about this, all right, we can look into a few points here. Okay. The first point that we can look into is the personalized medicine. Yeah. So by analyzing patient-specific data, all right, the healthcare providers can develop tailored treatment plans, and we can more likely, all right, to to be more effective, right? So every patient, they have their treatment plans, and the patient will aware of that particular plan, right? Yeah. And the next one, right, what we can say, why we can say that it improve patient outcome is another point that we look into early disease detection. Yeah. Big data can be used to identify early signs of diseases, and then it allow for the earlier intervention, right, and improve outcome. It means that, okay, the patient will get early, all right, early treatment, all right, because we already detect from earlier, we already detect some disease, all right, from the patient itself, right. So the next one is predictive analytics, right? Yeah. So by analyzing historical data, healthcare providers can predict the likelihood of certain health condition and take proactive steps to prevent them. For example, if the patient, alright, okay, ada ibunya ada diabetic, ya, bapanya ada juga diabetic, for example, alright, a diabetic patient. So on this, what we can say, this is what we can say on something that inherited, okay. So the diabetic, alright, so we can treat the patient earlier, right? Ya, biasanya this is what we call from the medical history, right? Ya. Kalau misalnya anak-anak pergi ke rumah sakit begitu, kadang-kadang dia tanya, ya, history, ibu bapa, tanya bagaimana keadaan ibu bapa, ada sakit ini ke, contohnya, ya. Alright, so that we, from that, all right, we can say that there's another information about the patient. So, all right, the what we call the doctor, all right, can make treatment plans, all right, from especially, all right, from the data that has been what we can say, that has been informed ataupun that has been inside, is already installed in the system. Okay, the next one is about the enhanced healthcare quality, right? Yeah. So, what does it mean of health quality here? All right. So basically, what we can say, it focus on certain points. The first one is we are looking on the reduced medical errors. Yeah. So big data can help identify patterns in medical errors. Yeah, and implement measures to prevent them. Yeah. All right. And another one, we can look into improve care coordination. So this is very important. Yeah. So by analyzing data, alright, from multiple sources, banyak, ya, datanya daripada pelbagai maklumat, daripada, for example, daripada sources yang berlainan, ya. So the healthcare providers can improve care coordination, right, and ensure that the patient receive the right care at the right time. That's the word. It means that the patient will receive the right care at the right time. Yeah, okay. And then we look also another point on enhanced patient safety. So the big data can be used to identify and address safety risks in healthcare settings. Yeah. So that is point on the enhanced healthcare quality. So the next one is reduce cost. Yeah. So from this, what we can look, okay, by analyzing data, all right, we have efficient resource allocation, right? Yeah. So healthcare organization can allocate resources more efficiently and reduce cost. Yeah, okay. And then preventive care, right? Yeah. Kalau di Malaysia, ya, biasanya kita ada case mix, ya. Maksudnya di sini, ya, kalau bisa patient itu menghadapi sudah dah diagnosed, ya, with breast cancer stage 1, ya. So di situ kita sudah tahu plannya apa kepada patient berkenaan. It means that kalau misalnya patient itu perlukan, kalau the patient need to go some of the procedures, alright, need to go to, for example, chemotherapy, alright, with the medicine, everything, right, sudah di from the case mix, it means that it's about the health economics, health financing, with the planning for the patient. So if at early stage, it means that the patient will need about 30,000, for example, all right, okay, for the patient to go with all the procedures, right, until the end of the procedures, then we can see that the outcomes of it. Yeah. So this is what we call a case mix insemination, right? So we already allocate, right, and of course the patient itself will more concerned about the cost, and at the same time they can plan, all right, the cost itself, all right, for the purpose of the patient's disease itself. Yeah. So and then another point is about fraud detection. Big data can be used to detect and prevent healthcare fraud. Yeah. So from this we can understand that, all right, any hospital either, all right, if example in Malaysia, government or private hospitals, all right, they already some amount of money is already being allocated for certain disease. Yeah. So it will be no fraud on this particular situation. Yeah. So the next one is accelerated drug discovery. All right. Yeah. So from this situation, we can say that by analyzing large data set of medical record, researchers can identify new users for existing drugs. Yeah. So biasanya di sini it will be some of drugs that has been banned. For example, it will be announced, all right, throughout social media, throughout the what we call website, for example, media, and all kinds of sources, all right, in order to inform to everyone that certain drugs has been banned, right, from the using, right. It means that the patients, all right, cannot use that kind of drugs, for example. Yeah. And then target identification. Big data can be used to identify new drug targets and accelerate the drug discovery process. Yeah. So it means that there are certain target, right? So, for example, children only, adults only, for example. Yeah. And then the next one, clinical trial optimization. Yeah. So big data can be used to optimize clinical trials, reducing, okay, the patients, okay, and all kinds of new treatments. All right. The next one, all right, is about population health management. Right. So basically, it is about the risk stratification, the health outcome assessment, and disease surveillance. Yeah? So this is a part of the population health management. The big data can be used to monitor disease outbreaks and track the spread of infectious disease. Yeah? So what we can say that in this point, all right, under benefit, big data analysis, all right, offers numerous benefit to the healthcare industries, right, including these kinds improve patient outcomes, enhance healthcare quality, all right. So till the population health management. All right, next slide, please. So we are looking on the utilization of medical records in big data analysis. Yeah? So what we can look here, all right, yeah, there are 7 points, all right, on the key applications utilization of medical records in big data analysis. Yeah? Next slide. So medical records, a treasure trove of patient information and becoming increasingly valuable, right, in the era of big data now. Yeah. So this record that we are having right now, when being analyzed using advanced techniques, yeah, and can offer profound insight into disease patterns, treatment effectiveness, and population health records. Yeah. So what are those things that we can look, all right? So this is same as well, the big data and what we have just now, we are talking just now in terms of the benefits. Yeah. So the first one, of course, clinical decision support. Yeah. How we utilize, all right, the medical record itself, all right, yeah, holds the tremendous potential for improving the healthcare, right? And so these are the points that we can look into. Yeah. The first point is clinical decision support. Yeah. So by having electronic health records, or EMR itself, whereby that what we can say, the platform contain large volume of structured and unstructured data. All right. Yeah. So for example, the patient demographic, medical history, diagnosis, medication, lab result, and so forth. Yeah. So the big data analytics can process this information to provide clinician with real-time, all right, real-time decision support. Yeah. The doctors need some information, all right. Yeah? So from this kind of information, it supports, all right, the doctors in order to make decision immediately, all right. Yeah. So aiding in a diagnosis, all right, yeah, is guiding untuk memberikan a diagnosis, treatment planning, and adherence to clinical guidelines, all right. Yeah. So from the patient information itself, right, so we can look at, okay, those kind of information will give what we can say benefits, or we can say thoroughly for the doctors, all right, in terms of clinical decision support, all right, yeah. So the popular health management, all right, how it goes, right, by aggregating and analyzing medical records from a population healthcare, all right, okay, and can gain insight into disease prevalence, treatment efficacy, and healthcare utilization patterns. Yeah. So this information enables proactive interventions targeted at specific patient cohorts. All right, and the new one, ultimately, it can improve, especially all right, the population health outcomes. Right. Yeah. And of course, we can look on the predictive analytics. Yeah. So how it goes. The situation is the medical records, when combined with big data analytics, right? It can be used to predict patient outcomes, all right? For example, readmission rates, disease progression, all right? Yeah? And potential complication, yeah? So from this prediction, right? Okay, it helped the healthcare providers identify high-risk patients and intervene to prevent adverse events. So it means that by looking at the information that has been in the system itself, right? Yeah, so we can look at how the doctors can make some prediction, right? So it means that from that kinds of analysis, the doctor can make some prediction, right? For example, kalau begini, kalau plannya begini, all right, the patient will be like this. If the patient will go under surgery, so the patient will receive this kind of outcome, for example. So this is what we call predictive analytics, yeah. And then also on the research and development, okay. So big data analysis on medical records contributes to medical research by providing access to vast data set of retrospective, for example, okay, clinical trials, yeah, and pharmacovigilance, for example, right? So these researchers can leverage, all right, this data can identify treatment trends, yeah, and then adverse the drug reaction, right, and factors influencing, for example, patient response to the therapies, yeah, all right, and performance improvement, all right, and so this another one. Next slide, okay. So how it goes with performance improvement, yeah. So the healthcare organization can utilize big data analytics to elevate the performance, yeah, of clinical pathways, for example, treatment protocols and healthcare providers, yeah. So by analyze medical research, they can identify some opportunities, right, to improve the quality of care and reduce operational inefficiencies and enhance patient satisfaction, right, yeah. And the next one, personalized medicine. So from this analysis that we can look into, all right, using the big data technique, support the implementation of personalized medicine, all right, yeah. So by leveraging patient specific data, all right, we can say that such as genetic information on this part, all right, the life cycle factors, treatment histories, healthcare providers can tailor. Maksudnya dia sudah nampak ya bagaimana kehidupan patient tersebut with this kind of information. Alright, so the doctors and the healthcare professionals can tailor treatment plans to individual patient, maximize therapeutic, all right, efficacy, all right, yeah. So the last one is healthcare cost management, and of course we can identify cost drivers and inefficiencies in healthcare delivery. So we can look, we can by uncovering healthcare certain utilization patterns, and we can say that the resource allocation trends, right? We can look on the certain it can optimize, all right, the infrastructure, for example, right, reduce unnecessary expenses, and of course it can improve the financial stability, all right, yeah. So the next slide, all right, we can look issues and challenges, all right, yeah. All right, so what we can look into the issues and challenges here, okay. All right, so the issues challenges, while big data offers immense potential, it also presents challenges such as data security, privacy concern, and the need for skilled professionals. Yeah, so we can address certain consideration. Yeah, it's crucial to harnessing the full benefit of data analytics in healthcare. Right. Yeah. So let us look on the certain points of issue and challenges. Next slide, please. Okay. So let us. Hello, can you listen? All right. Okay. So this is data quality. All right. Some of the issues and challenges. Okay, is about the data quality. All right. We have 4 points here: issues and challenges. Right. Data quality. All right. Data privacy and security, and interoperability and ethics perspective. Yeah. So on the data quality, is ensure data accuracy, completeness, and consistent is crucial for reliable analysis. All right. Yeah. So this is another part, another level. It need to be consistent. All right. So this is what we can say. Then we can look on the reliable part on that part. And then we also look on the data privacy and security, whereby okay, protecting patient privacy right, while utilized medical records requires robust security measures and adherence to data protection regulation. Right. Yeah? So although we are having various of information, right? But we also need to know, right, to understand the words of privacy and security, right? Yeah. So all data need to be protected. Yeah. So the next one, interoperability, integrate data from different healthcare systems and providers can be challenging due to varying standards and format. This is another one, right? Yeah. I will show you some of examples right now, okay, that we are having in Malaysia. Some of them, once we apply the EMR in the hospital, right? Yeah? So we have two situations. The first situation whereby the hospital is being built up, all right? Okay, a new hospital built up, and the system has been installed in the hospital itself, yeah, di rumah sakit, ya, begitu. Kemudian that one is easily whereby one system can control everything. There's another part whereby is the old hospital, whereby what we can look here, they are going into a situation, in situation that it cannot be the whole of the system immediately. For example, today we install the system, all right, and tomorrow we are having a new system, all right. Yeah? Previously we are in the traditional paper, and tomorrow we are going to the system, right? It cannot be done like that. It need to be face to face. It need to go stages by stages. So right now, what we are having problem right now in terms of interoperability, there are certain hospital, the old hospitals in Malaysia, all right, one department goes for the, for example, seperti contohnya pharmacy, all right, that particular department already goes for the system. All right, they have the vendor, all right, and so they are going for that particular system. For example, we call as system pharmacy system, right? Then after 2-3 months, all right, the department of radiology, for example, all right, and they are going for the system. Okay, so having said that, every department they have their own system. Then comes of this is what we call issues and challenges, right? Yeah, how we want to integrate data from different healthcare system, from different departments. So this is the thing that we need to play as a management in that particular hospital. They need to be once they what we can say that they recruit what they hire the system provider, for example. So they need to put some element requirement. It means that they need to be open system, not to be closed system, right? Yeah? Kalau misalnya closed system, it will be difficult to having interoperability. We cannot, orang kata, what we can integrate the data. So every department, right, they can have their own system, but it need to be open system. Towards the end, right, once we want to apply the EMR, so the most important thing is the integrating data. So that's the point here. All right, the next one is ethics, perspective. Using patient data for research and analysis raises ethical questions about informed consent and data ownership. Right, ya. Ini ada sedikit what we can say problemnya, iaitu tentang consent, about the informed consent and data ownership. This is among the issues and challenges. Yeah. So let us look on the future trends here. All right. I think I need to be quick a little bit. Right. Next slide. All right. So the future trends, what we can have a look here. Okay. Next one. Okay. It means that the future of healthcare will continue to be shaped by big data with advancement in artificial intelligence, AI,
Excuse
machine.
me. Excuse
Yes.
me, Dr. Nick.
Yeah.
We have about 10 minutes left.
Yeah. I will be quick here. Okay, thank you, Ibu Jana. All right, and real-time data analysis, embracing this trend will drive through innovation and transform the delivery of care. All right, yeah. So let us look on the next slide. Okay, so this is what we can say the 5 ways the healthcare industry could be used big data and why it's not. All right, yeah. Preventing medication errors, we can identifying high-risk patient. Okay, reducing hospital costs and wait times, preventing security breaches and fraud, enhancing patient engagement and outcomes, and the last one, widespread use of electronic health records. Yeah. So this is a part, the 5 ways healthcare industry could use big data and why it's not. So the next slide, all right. Okay. So, looking on this, what we can say that, okay, the healthcare, the 5 digital trends for 2020 and beyond on this part, yeah. So what we can look here, okay, so this COVID-19, all right, outbreak has irreversibly changed the attitude toward digitalization in healthcare, right? So we can see that the turning point of using electronic health records, EMR, or digitization, for example, all right, yes, starting from the COVID-19 outbreak, yeah. So we can say that on the things previously seen just visible away, and we are moving fast towards a certain level, all right, due to this kind of disease outbreak, all right. So the next slide. Okay. So the 5 top digital healthcare trends, all right, we can look into the artificial intelligence, healthcare, new nervous system, big data analytics for prevention and intervention, the internet of medical things and wearable devices, telemedicine as new healthcare reality, and the last one, virtual or augmented or mixed reality in medicine. All right, yeah. So the next one, this is about the case study, all right, yeah. I just want to give you some of the points of case studies here. Yeah? So the healthcare industry is growing so fast, and we can say that it requires new modern technologies to be adopted in the industry to improve outcomes and reduce costs. Yeah? One example that we can look on the technology, all right, is about the include the use of big data, right, and analytics in the healthcare. Yeah? So the healthcare data is created every day, right, from various and numerous sources. Right, it includes the EHR, all right, the healthcare IoT, Internet of Things, medical imaging, and so forth. Yeah. So in this case, the big data in the healthcare industry could be used to identify the high-risk patient. So in this, what we can say that the patient pattern can be identified easily, quick, all right, and more effectively once we are using EHR or EMR. All right, it helps in reducing managing costs by following a value-based patient-centric model, for example. So furthermore, and we have a predictive model, the number of patients coming in the next up can be predicted. Alright, kita sudah dapat tahu berapa orang yang akan datang. Alright, can make a prediction on that. Right, big data also can prevent medication error. So using big data also, error can be detected and red flag to reduce mistake, for example, and when medication is prescribed and save a life. Yeah. So that is another one that I want to put it. Alright, it's a raw. First, it is a raw data set. Right, and then some people refer to as sushi principle, yang maksudnya data is best when it's raw, fresh and unstructured than cooked. Alright, yeah. Secondly, big data is less expensive to own and to operate due to its unstructured and it comes from open source origin. Yeah. So this is something that we need to look. And another one that I can show you example, like in Malaysia we have the apps, My Sejahtera apps, especially during the COVID-19. Yeah. So every one of us need to have this kind of apps. So need to update, all right, from time to time. Okay. So if certain, for example, if the patient at the house and make their own what we call treatment, for example, or we just look at the oxygen level. If the oxygen level drop, right, so it has some alarms there, need to go to the hospital and call the ambulance immediately. All right, so this kind of what we can say the My Sejahtera apps is a mobile apps developed by Entomo Malaysia and the government of Malaysia, all right, in order to manage COVID-19 outbreak in Malaysia. So this is a part of what we can say big data itself. Yeah, everyone, and of course, from time to time we need to update the information itself. Yeah, so it can be used to conduct contact tracing, self quarantine, and also book COVID-19 vaccination appointments. Right, and the last one, conclusion. All right, so we can look here, conclusion. All right, yeah, so what we can say that, yeah, to use the next slide please, to use a world of information more simply and to enrich the user experience, we use big data. So big data result in making process efficient and also hasten decision making process. It simply refers to innovation or adding creativity to existing processes. All right, next slide. Next slide please. All right, yeah. So on behalf of this, what we can say, the conclusion on the big data in the healthcare industry can contribute to more efficient. All right, you need to click another one. It's still not complete there. Big data in the healthcare industry can contribute to more efficient healthcare because it changes the way patients and doctors in handling care. So healthcare big data refers to collecting and analyzing the patient's clinic data. All right, yeah. So next point. Okay. All right. So currently what we can have a look, the health data are being collected, all right, through EMR, social media, mobile phones, and much more. So the increasing of establishment of big data in healthcare is in response to the digitization of health information. Concurrently, will encourage the usage of big data, right, the data analytics. So what we can look here, the rise of big data means an improvement in the healthcare industry where decision making is not based on experience but more on the big data research. Yeah? All right, okay. With that, thank you so much. All right, thank you semua. These are the references, okay? And then we can have a look, all right, if you need to personal email. So this is my email. All right, thank you for everyone, all right? And thank you anak-anak semua yang di sana, lebih kurang ramai ya yang ada sekarang ni ya. All right, yeah. So on Saturday, it's good for you to rest, but you really sacrifice yourself to attend this kind of knowledge seminar, right? Yeah. So thank you so much. Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh. Oh, thank you so much, Dr. Nick Azliza, Nick Arifin, for what a very insightful talk. Now we will open the discussion session. Let's see from the chat. And if there is the audience want to ask directly to the speaker, you can raise your hand.
Bisa ya berbahasa Indonesia saya, insya-Allah. Sekarang ini sudah ramai keluarga di Indonesia, saya sudah bisa bertutur dalam bahasa Indonesia ya, insya-Allah. Right. Jangan malu, boleh tanya ya.
Yeah, okay. You can ask in Indonesian.
Ya, ya.
Okay, if there is no questions, yeah, because I didn't see the question. Oh, wait.
Ada soalannya.
Okay, there is one question from Salsa Nur Adila. The question is, as we know, the development of AI has already spread to various fields in this context. What is the potential of AI to enter the healthcare sector, and can it be effectively integrated into medical records management system to analyze big data? Yeah.
Jawapan saya iya. Right? We cannot deny the AI. We cannot deny with that kind of artificial intelligence, right? But another thing that we need to bear, right? This is what we call issues and challenges, right? The privacy itself, right? So pastinya kita, human pastinya kena ada because of we need to monitor the whole system itself, right? Okay, AI is there. Sebelum ni enggak ada AI pun, right? Tapi coming right now, everything in AI. Okay, there are certain things that we look into potential, all right, into the potential that AI will intervene, right, into certain aspects, especially. But there are certain things that we can say that doctors must be there, nurses must be there, right? So, however, right, for example, right, telemedicine. We know the telemedicine, right? So that will be whereby AI will will come into the picture, right? So this is a part whereby sometimes, right, we need to understand that the IT is rapidly changing, right? Maybe lepas ni saya tengok ada one movie yang mana dulunya kita panggil tourist guide, Ibu Nadia, Ibu Diana, tourist guide. It means that right now they no more with tourist guide. There's a robot assist, right? Robot assist. Okay, the what we call the visitors, right? To look into the place itself, right? So it means that, okay, soalan certain things that we can look into, maybe ramai visitors on that part, and the robot comes into, right, to show, okay, this is the part, and they explaining, right, one by one, right, inside that particular museum, right, this is a museum, is where we can look into AI punya concept, yeah? And of course in healthcare, right, in healthcare, pastinya contohnya sekarang pun sudah ada. Saya selalu juga tengok Hello Doctor. Di Indonesia ada Hello Doctor ya, Ibu Diana ya. Hello Doctor ya. Ya, ya. Sangat bagus. That's a part of it. Okay, itu sudah ada sebenarnya. Yang mana bisa macam di Malaysia pun sudah ada. So di Indonesia saya look into the Hello Doctor as well, whereby it comes into, lepas ini ada ya gambarnya begitu, and someone will talk about this, go into a picture. Alright, yeah. So something that will be more informative dan kita sebenarnya sekarang we want to get information easily, right? Klik saja sudah keluar. Klik saja we got the information, right? Yeah? So sebenarnya dengan information yang kita ada sebenarnya it will help. It is not only for the doctors, tetapi sebagai kita sebagai orang biasa. For example, saya bersama Ibu Diana sedang makan, ya. Tiba-tiba Ibu Diana macam, oh, dadan dia pegang dadanya begitu ya. Alright, saya kata, Ibu kenapa Ibu ya? Saya mungkin tidak ada, macam dulu kita kena pergi kursus ya, first aid kit, if everything here. But by having this kind of situation, I just go into the system whatever. Alright, oh kalau Ibu Diana begini, mukanya sudah merah-merah, sudah nak mau jadi sudah tiada darah begitu ya. So apa yang saya perlu buat? So from that immediately. So these are the things that we need to have. Alright, every country already have that kind of thing. Alright, so pastinya bagaimana kita perlu menghadapi, alright, the situation itself. Alright, we need to be prepared right now. Alright, seperti dulu semua orang tidak mau guna IT. Komputer ni bagi orang yang senior citizen, bagi yang muda-muda ya Ibu ya, suka sangat komputernya. Kalau tiada gadgetnya enggak boleh hidup gitu ya. Tapi kalau misalnya untuk yang tua-tua, you can see that the doctors are senior citizens, alright? So sometimes they are biasanya guna tangan ya untuk menulis dalam paper ya. But right now we ask them to change. It's very difficult for them. But they need to go. They need to face that kind of situation. So we are giving training to them. Alright, klik ya. Tidak perlu sampai level yang advance ya. Kalau administrators, kalau misalnya kita dalam rekam medis begitu, ya kita perlu ya certain level go into that. But untuk certain level, alright, for the senior citizens, senior administrators, senior doctors, senior nurses, so we will just teach them into a moderate level, not into, right? So we need them because they will key in some information about the patient sometimes, right? So basically about AI, yes, I agree. By hook or by crook, yes, possibility memang sudah ada dalam dunia healthcare itu sendiri, right? There's another question that I can look here, Ibu Diana di sini.
Yes, yes.
Soalannya
Thank you
ada
so
di sini.
much. We still have another question
Okay,
from
okay.
Sofiatul Kamila. Yes,
Ya, namanya tidak ada nama
Sofiatul
disebut.
Kamila. How to
Is it
overcome the
adanya-
problem? Yes, of
Ah,
equal distribution of
okay.
EMR in Malaysia, and is it effective to apply it also in Indonesia?
Ya, apa itu pemerataan in English, yang Ibu Jana disebut pemerataan, apa maksudnya di sini?
Maksudnya itu it will be distribute all over Indonesia because as we know
Okay,
Indonesia
alright,
is a big,
okay,
yeah,
okay, I
so
understand.
many,
Okay.
yeah, 38 islands.
Okay, it means that it will be
We have so many rural area as well.
yeah, okay. That it comes from the, what we can say that it need to be come from top to down, management instruction. Okay. Saya bagi contohnya di Malaysia ya, Ibu. Okay. Di Malaysia tak semuanya hospital sudah EMR. Right? Sama juga it need to be phase by phase. Maksudnya di sini, right? Ada hospital, just now I already mentioned, there are certain hospitals yang sudah a new hospital, kita build up hospital, alright, and we put all the system. So we don't have any problems there because that hospital is new dan setiap orang ada setiap staff, doctors, nurses, alright, and all departments ada computer, install the system, run the system, done. Okay, number one. Another situation whereby we have about 146 hospital, right, and only about 13%, right, yang go for that particular EMR, ya. Dan we have level, right. In Malaysia kita ada 3 level. Yang pertama iaitu HIS. Yang kedua levelnya IHIS. Yang last level yang tertinggi THIS. Apa yang saya bicarakan tadi itu, yang semuanya komputer itu, we call Total Hospital Information System. From the beginning patient come into the hospital, rumah sakit ya, sehingga akhirnya proses mendapat ubat, everything is in the electronic system. Itu kita panggil Total Hospital Information System. Alright, ya. In Malaysia, we have only about a few hospitals on that falls under that particular category. Another 2 categories right now that we have 100 plus of hospital which is at level 1 and level 2. The level 1 mean hospital information system. The next one is IHIS, means intermediate hospital information system. Alright, what does it mean of intermediate? Alright, they are the level 1 and level 2. Let's go to level 1. Level 1 is only certain department saja yang mana kita nampak, ya, yang mana kita tahu bahawa that particular hospital, alright, only a few department, hanya satu saja go. For example, bahagian radiology department go for system, pharmacy go for the system, alright, itu kita panggil hospital information system, level 1. Another one is intermediate. Intermediate means most, kebanyakan sudah go for the system. Only it cannot be connected because of the patient repository. Maksudnya, patient to information not being connected. So that what we call intermediate hospital information system. So that is in Malaysia, alright, yeah. So what have been done in Malaysia, they are go for one by one, alright. Saya juga berada di dalam jawatan kuasa ya di Kementerian Kesehatan Malaysia, iaitu transformation, alright, transformation from what you can say that manual to electronic, alright, yeah? So right now we already have one hospital which is totally based paper, memang paper, alright, yeah? So right now, menjadikan ia sebagai pilot study, what are the requirements, everything, in order to go for the EMR, right? So
So,
apa yang saya katakan di sini, pastinya, right, it need to be top down management, right? It means that the top authority, they have vision, right? Go for the electronic health records, whereby it will be interconnecting among the rumah sakit. Saya pastinya di Indonesia banyak rumah sakit, ya, dan we need to go first phase by phase, right? Need to do some of the, what we can say that hospitalnya adanya primary care, ya, ada secondary care, ada yang tertiary care, alright, ya. So planningnya pastinya I believe that, ya, Indonesian healthcare ministry, alright, already provide the best for Malaysian, for Indonesian healthcare. All right, thank you.
yes. Actually, Indonesian Ministry of Health already published the regulation of Ministry of Health number 24 year 2022 about the electronic medical records. So now we are working for already 2 years to adapt it to adapt from the manual to electronic, like that. How about Malaysia, doctor? Is it already?
Yeah, we already have this. Right? We already since
100%.
1999. Yeah, not 100% all hospital.
Okay.
EMR, yes, right? Ibu Diana, kita ada EMR, but right now we are going to EHR. EHR means all
okay.
hospitals
Yeah,
will be
interoperability. Yeah.
Right.
Yeah. Okay.
Sekarang ni kita masih go for EMR. It means that every hospital are moving forward.
Yes,
And we have certain hospitals already EMR. It means that totally using EMR. Right?
Yeah.
Okay.
We are also working on this.
Yes,
Same.
we are still. I understand that. We also get some input from Indonesia, right? And I also get a lot of insights, especially right once I communicate and discussion with some of the sebagai expert yang di Indonesia, right? Yang boleh diguna pakai di Malaysia. Ya, antaranya ialah coding. Right, I really respect the Indonesian healthcare system about the coder itself, right? Yeah. So Malaysia di sini perlu belajar, ya, tentang coder itu sendiri, yang mana di Indonesia we have many coders, and kita di sini sebabnya prinsipalnya satu saja, iaitu only principal diagnosis that being coded. Tetapi tidak di Indonesia, ya, semuanya sekali, ya. So these are the things that we need to learn from Indonesia. Alright, thank you everyone.
Yes, thank you. We still have time, about 10 minutes more.
Okay.
Another question from me.
Yeah.
Regarding to the predicting analysis, like you have explained before, how do you
Yes.
ensure the quality and accuracy of the big data being analyzed in big data project, particularly when dealing with medical records that may have inconsistencies or incomplete information?
Okay. All right. Thank you, Ibu. Okay, begini, ya. That's why we call prediction. All right, prediction. So from the prediction, for example, this is the case that one of the research right now sedang dijalankan, ya, researchnya, ya, Ibu, ya. So antaranya that we can look into in terms of prediction, for example, seperti tadi, ya, ibunya ada diabetik, ya, bapanya pun ada diabetik, ya, keluarganya ada this kind of history, right, ya. So anaknya sekarang ni sepertinya ibunya agak berhati-hati, ya. Kadang-kadang walaupun lifestyle-nya biasa, sudah protect-nya, tetapi tetap ada. This is what we call inherited. So from that, okay, but then they need to go check all the time. Sudah diberikan, satu hospital tu sudah diberikan treatment plan for the kid itself. Right, so they protect the kids not to be like them, not to be, orang kata, one of the diabetic patient. So they plan they go to the hospital, right, and they said that the parents, as I mentioned, that both parents also have the diabetic, and right now they also have the diabetic, all right. Also they control, but that's it. That is inherited part. So however, alright, to the kid itself, anak tu sendiri, mereka sudah pergi ke hospital untuk dapatkan a treatment plan, right? So from that situation, alright, they will monitor the patient. It means that the patient needs to come to the hospital, alright, at least twice a year untuk menjalani kita panggil rawatan begitu ya. Monitoring level tu ada. Starting that particular kids tu umurnya 6 tahun ya, 6 years ya. So apa yang kita lihat di sini ialah what we can look into, the patient will be monitored from time to time. Alright ya. So the point yang ibu berkata tadi, it will be ada early detection. Nampak ibu ya? Kalau tiba-tibanya suddenly, alright, contohnya sudah 3 tahun, okay, alright. Then once the kids go to the school and suddenly sudah nampak peningkatan dari segi level, sugar levelnya. So di situ kita nampak apa pemakanan kanak-kanak itu. Right, mungkin di sekolahnya ada makan jajan-jajan gitu. Kan? Jadi sudah ada early detection. Right, yeah? So yang ini perlu dikawal. That's why right now they have this kind of treatment. Early detection sudah ada. Prediction, yes, of course. Possibility anak itu mungkin ada. Ya. Tapi we need to look at the consistent of data itself. Tahun pertama, okay. Tahun kedua, okay. Tahun ketiga, okay. Tahun keempat sudah nampak peningkatan sikit. Jadi kita tengok, bagaimana pemakanannya. Sekarang sudah pandai beli-beli di sekolah ya. Sudah jajan-jajannya, aiskrimnya, apakah. So, this kind of situation. Monitoring level sudah ada. So, ibu dan the both parents will guide, advise to the kids. Alright? Maybe you can eat maybe once a week, for example. If you want to buy, alright, let me buy for you, for example. So this kind of things, yeah. So kalau tidak ada penyakit begini-begini. Sebab di Malaysia sekarang ni sudah ada kita kata one of the highest level on diabetic Malaysia ya ibu ya. Alright, di Indonesia ada. Ini kena belajar di Indonesia, makan jamu saja ya. Di Indonesia, di Malaysia banyak makan manis-manis ya. So apa yang saya nak beritahu ialah sudah ada health education on diabetic patient. Alright, sudah ada keluar advertisement kanak-kanak yang menghidapi diabetik. Maksudnya apa? Maksudnya di sini daripada data yang sudah dapat dari peringkat Malaysia, alright ya, di informatic center sudah ada patient di kalangan diabetik, maksudnya it already increase. So once increase, of course, alright, the health ministry, alright, will educate. Sebab sekarang sudah masuk di radio, alright, pastikan anak-anak anda dalam kawalan pemakanan, alright, tidak menghadapi diabetik, sudah keluar advertisement itu. So it means that, alright, I believe that the statistic shows, alright, the increase of the patient, right, especially among the kids on diabetic level, right. So this is what we call prediction. Yang mana prediction tu consistent and up kita nampak sudah ada perubahan, maka perlu ada dari awal sudah ada monitoring, dan kita pastinya kita ada rawatan segera di situ ya. Okey, itu saja ibu ya, mungkin menjawab soalan ibu.
Okay, it's very clear. Thank you, Doctor. And we still have about 3 minutes more.
Okay.
So there is one question from the chat room.
Okay.
From Aulia Naslif Alfi. So far, what are the main challenges integrating different healthcare system data for big data analysis, and how can they be overcome?
Okay. All right. Talking about the integration, this is about interoperability just now. I already mentioned, yeah. So one of those points, okay, saya juga terlibat dalam pemilihan kadang maksudnya provider ya, okay, IT provider ya. So seperti mana yang kita tahu tadi, pelbagai sistem di dalam sesebuah organisasi, contohnya hospital, department, contohnya lah department di bahagian lab guna sistem A, alright, dari rekam medis department for example guna sistem B, right, dan kita nak pastinya administration guna sistem C for example ya. So these are system because of what? Why they are system A, B, C? Because they are not doing at one time. They are doing phase by phase. Yang ini yang saya katakan ya. So now the problem is how we want to integrate. how we will integrate all kinds of multiple sources. Okay, the first thing is talking about the interoperability, right? Yeah? That's why the main point is the system need to be open system, right? Yeah? So maksudnya sistem A, sistem B, sistem semua dia boleh dibaca. Tidak ada closed system. Closed system maksudnya, alright, the system will not read, cannot read because they protect the information. Alright, yeah. So dalam hal ini, alright, especially the old hospital in Malaysia right now, what we are doing that, alright, we are having what we call the open system, and the IT department is as what we can say the person in charge looking at the all system in the hospital, right? Yeah? So they are looking, okay, if we want to integrate this one, so we have one what we can say the database, what we call a repository, whereby the doctor can look into the whole of the system itself. That will be the most important part. Yeah. So pastinya di sini, that's why I always mention to my students, alright, do not neglect information professionals. Who are they? You are the information professionals. We have the IT professionals, all right, who are creating the software, develop the software, all right, yeah. And we also have the healthcare professional who are basically the users, all right, the main users, the doctors, the nurses, all right, the pharmacists, for example. And of course, this part is what we call the information professionals. Yeah, who are they? We are. Anak-anak sekalian adalah information professional. Bila kita once we want to develop the system, we need these three professionals: IT professionals, information professionals, and healthcare professionals. All right, yeah, they need to be sit together. All right, and what we can say that solve the problems. All right, yeah, how to integrate to each other. It is not on part of IT only. Alright, yeah. So bila kadang-kadang bila berada di saya menjadi salah satu panel untuk recruit the IT providers, alright. Saya the information professional, the medical record officer here, yeah, the health information di sini panggil medical record, di sana panggil rekam medis, ya. So rekam medis itu merupakan salah satu information professional, right? Kita panggil then because the most important person is information professional, sebab dia tahu the whole of procedures, the whole of process di dalam hospital. Alright, yeah. So what we can say that the information guardian is falls under information professional. Alright. So jangan kata selepas ini sudah ada sistem, kita tidak boleh buat apa-apa, sudah tak ada kerja. No. We are the information guardian. Kita penjaga maklumat di dalam hospital itu. We are the information professionals who are monitoring the information, alright, looking at the information, alright, kita penjaga. Even IT, if we have the problem, yes, we call IT person to look into. But in terms of information, you are the one, alright, yeah. So that's why I always mention to my student, right? Yeah, we are the information professionals. In fact, alright, there is one meeting there. Saya kata bila mau buat sistem apa-apa ya seperti ini perlu ada. Ya, jangan lupa pegawai rekam medis ini ya, sebab mereka ini merupakan kita katakan the whole record in the rumah sakit, rumah hospital. Inilah orangnya. Alright, the process inilah orangnya tahu semuanya ya. So in terms of you want to design the system, you need to call them. They need to be part of the system itself. Alright, they need to know what is going on. Alright, bukannya kadang-kadang we just look tanya pada doktor. So the IT professional, okay, bisa Pak Doktor, kita boleh bisa begini-begini. End up tidak boleh. Alright, so I'm talking based on the experience that I have done previously, yang mana they neglect the role of the information professional. End upnya sistem tidak jalan. Right, yeah? Because the IT professional, they go for the system, but they not look into the process. The process is we know the process. Alright, the whole sistemnya besar ya, bukan sistemnya komputer saja ya. Maksudnya proses also system. So the whole process dalam hospital itu pastinya siapa yang berada di dalam rekam medis pastinya tahu ya, begitu. Alright, thank you.
Okay, thank you. Before we close the first session, maybe I would like to ask your advice to us if someone in the audience were looking to explore a career or research in big data and healthcare.
Okay. Career in healthcare. What do you mean by
Yes.
that, Ibu? Maksudnya apa, Ibu?
The career or research in big
Okay.
data. Yeah.
Yeah, okay. Um, okay, talking about healthcare. Walaupun contohnya macam COVID-19 ya, outbreaks ya. Tempat-tempat lain close ya, tapi healthcare tidak close ya. Ya. Rumah sakit tidak tutup ya, dan kita pastinya bekerja 24 hours begitu ya. So it is amazingly, alright, what we can, this is my personal view, alright, we can understand that the hospital, kalau di Malaysia ya, hospital tu tumbuhnya seperti cendawan ya, Ibu Yana ya. So pelajar-pelajar saya sudah grad, pastinya terus boleh bekerja, yang mana ambil kursus saya, right, medical records and health information management, pastinya mereka sudah ditawarkan kerja. Baru ini 2-3 orang Ibu, saya sudah mendapat di Thomson Hospital, private here and there, kata go for it, right ya. Sebabnya kalau although we are already in IT, okay, the hospital totally in IT, we also have our part in that particular place, in that particular rumah sakit ataupun hospital, right? Yeah. So we can look that right now, the IT is always increasingly. Big data also. Pada mulanya data is a normal data. Why they call as a big data? Because they have a lot of data. They call a big data. Dan big data itu pula dalam bentuk pelbagai. Ada yang structured, ada unstructured, and the volumes are really in a large volume. Right, yeah? So how we want to maintain the big data? So it comes us in order to maintain the big data. I give you one example ya, Ibu Diana. Pada awalnya ya, one of the hospitals, this is one of my findings the research, one of the hospital which is totally using EMR, right? Tetapi bila saya buat interview ya, saya tanya bagaimana ya bila sudah apply EMR begini. Dia kata, oh kerja saya makin bertambah. Ayo, saya kata, bertambah? Kalau ikutnya, kita panggil apa ya, benefits-nya, workload-nya berkurang ya Ibu ya. Maksudnya sudah sistem kan, pastinya berkurangan ya. Tapi bila saya interview the person itself, qualitative, katanya workload-nya bertambah. Saya kata, kenapa ya bertambah? Oh biasanya kalau yang biasa dulu paper pukul 6 saya sudah balik rumah. Tapi sudah ada sekarang ni elektronik, totally using elektronik. Saya balik 10 malam. Lama. Saya kata, ini sudah framework saya sudah lari ni ya Ibu ya. Frameworknya sudah macam mana ni? And then saya pun bercakap dengan what we call that, the head of department ya. Kebetulan head of department is my student. Was my student ya. Saya kata, macam mana puan ini ni? Itu rupanya baru saya tahu kenapa dia kata workload ni bertambah. Because of ini yang semasa itu EMR in the hospital. EMR, electronic medical record, sistem yang digunakan dalam hospital tersebut saja. Tetapi Kementerian Kesehatan Malaysia, ini Ministry of Health, mereka keluarkan sistem juga. Tapi sistem tu need to be, kita panggil, semua boleh pakai. So apa yang terjadi ialah that particular system tu sudah masuk dalam sistem EMR. Dan apa yang terjadi, kenapa workloadnya bertambah, dia kena extract keluar maklumat yang ada di situ dan masuk dalam sistem yang besar dalam Kementerian Kesihatan. Then it comes then. Dan saya kata, okay, kalau begitu, maksudnya sekarang ni sistem tu perlu tukar, sistem dalam hospital berkenaan. So saya sit down with the ketua jabatan situ dan IT department, dan orang kata a few of the REKAM MEDIS. Maksudnya tadi information professionals. What to do? So dalam sistem yang dalam hospital berkenaan, kita masukkan apa elemen-elemen yang perlu ada di dalam yang ada dalam sistem kementerian, maksudnya the Ministry of Health punya sistem, right ya. So kita masukkan terus, masuk within 1 month, tak sampai 1 month lah Ibu ya, sudah masuk, sudah yang balik pukul 10 malam sudah balik pukul 6 petang. Sebabnya kita boleh keluarkan report. So sistemnya sudah ada, apa yang diminta oleh Kementerian Kesihatan, right, sudah ada dalam sistem MIN dalam hospital berkenaan, right ya. So we can integrate, yes we can integrate. That's why, right, okay, kita sebagai rekam medis yang kita tahu yang mana, no wonder lah banyaknya sebab dalam sistem yang berkenaan, dalam sistem main sistem tidak ada elemen-elemen di dalam sistem yang dalam hospital berkenaan. So with that kind of situation, all right, we need to sit down again, all right, develop a new one, add a certain things, element-element yang diperlukan, and upnya within 2 weeks, 2 to 3 weeks, settle. So yang balik lambat tadi sudah balik awal ya ibu ya. Sebelum ni 10 malam balik sebab dia kena keluarkan, extractkan dalam sistem berkenaan dan baru dimasukkan di dalam sistem the main system. No wonder lah balik malam lambat, jadi double duplicate, banyak kerja ya.
Double works.
Yeah, so this is learn from experience.
Yeah.
So begitu. So kita nampak bagaimana. So these are all the things that maybe as a guidance experience to you all as well, right? Yes, that's why saya pegang bahawa information professionals something that being needed, right? Yeah? Those who are in this field, right? You don't feel that nanti tidak ada apa-apa sebab hospital kadang-kadang kalau tak pasti ya di Indonesia ya, populationnya ramai, pastinya ada yang private ya, begitu ya. Di Malaysia private-nya sudah banyak. Dulunya private di daerah, di distrik daerahnya, kita panggil distrik ya, semua distrik tidak ada, tapi sekarang sudah ada. Satu distrik sudah ada private hospital. So we need those who are in our area to work there. Alright. Okay, thank you.
Okay, thank you. What a very interesting discussion, actually. Thank you once again to our esteemed speaker, Nik Azliza, Nik Arifin, PhD, for sharing such valuable insights with us today. I believe we have all gained a deeper understanding of the potential and challenges of utilizing medical records in big data analysis. With that, I'd like to conclude this part of the session. There are several benefits of big data analysis in healthcare. The first is improved patient outcomes. Second, enhanced healthcare quality. The third, it's reduced cost. Fourth, accelerated drug discovery. And a fifth, population health management. And then also, there are several utilization of medical records in big data analysis. The first, clinical decision support, and then predictive analytics and population health management, research and development, performance improvement, personalized medicine, and healthcare cost management. But also have several issues and challenges in data quality, data privacy and security, interoperability and ethics. I think that's all the conclusion for the first session. And before we are going to the next session, we will give a certificate to our distinguished speaker, Nik Azliza, Nik Arifin, PhD. Okay, this is the certificate. The certificate is yours. Thank you so much. Now we are closing the first session.
Thank you, everyone.
Thank you. Now I hand the floor back to our MC, Aisyah, to guide us through the next segment of the event. Thank you.
Okay, thank you, Miss Diana. Now for the next presenter is Miss Dea Putri Apriliana, Bachelor of Computer as GDMI Admin. To Miss Diana, time is yours. Hello, Miss Diana. Hello, Miss Dea. You can start the material.
Oke, baik, terima kasih untuk pembawa acara. Saya izin untuk memberikan tutorial dan izin mengambil alih ya Kak ya.
Ya.
Oke, semuanya perkenalkan, nama saya Dea. Saya dari Gadan Medik Indonesia. Di sini saya izin untuk memberikan tutorial terkait akun pelataran sehat. Teman-teman boleh membuka akun Satu Sehatnya terlebih dahulu agar kita bersama-sama untuk tutorial akun Satu Sehatnya agar lebih mudah ya. Saya izin share screen untuk memberikan tutorial. Baik, untuk share screenan saya sudah terlihat kan ya teman-teman ya? Pertama-tama,
Sudah Mbak.
oh iya,
Ya, sudah Pak.
terima kasih. Pertama-tama teman-teman silahkan masukkan email dan passwordnya terlebih dahulu di Satu Sehat SDMK-nya. Lalu teman-teman klik nanti di sini pelataran sehat. Kalau teman-teman membukanya lewat HP, bisa klik garis 3, lalu nanti klik pelataran sehatnya. Nah, nanti di sini muncul cari pembelajaran. Nanti teman-teman bisa klik saja. Dan disarankan untuk membuka akun Satu Sehat ini atau LMS ini menggunakan web browser Chrome. Kalau yang membukanya atau lewat HP, apalagi HP-nya yang iPhone, disarankan membukanya lewat Chrome, jangan lewat Safari ya teman-teman. Nanti kalau misalkan teman-teman membukanya lewat Safari, pas klik cari pembelajaran di sini nanti muncul login SSO seperti itu. Jadi sekarang teman-teman tinggal klik aja cari pembelajarannya. Lalu halamannya akan berubah menjadi ke LMS Kemenkes. Lalu teman-teman bisa klik saja di sini profil sebelah kanan atas ini. Nanti kalau yang membukanya lewat HP bisa klik garis 3. Lalu teman-teman bisa klik pembelajaran saya. Sudah mengeklik pembelajaran saya, nanti di sini ada muncul beberapa panel. Teman-teman bisa klik saja belum dimulai. Kalau yang membukanya lewat HP bisa digeser saja panelnya sampai nanti teman-teman klik belum dimulainya nanti di sini ya. Selanjutnya, sudah mengeklik panel belum dimulainya, bisa teman-teman semua klik detail seminar. Di sebelah sini yang berwarna hijau, diklik saja. Lalu setelah teman-teman ngeklik detail seminarnya nanti, klik saja yang tombol berwarna hijau. Di sebelah sini ada klik mulai belajar. Kalau yang membukanya lewat HP, bisa scroll saja mulai belajarnya nanti ada di paling bawah. Klik saja mulai belajarnya. Karena di sini sasaran pesertanya tidak sesuai dengan profesi nakes saya, diklik iya aja. Lalu teman-teman bisa klik bagian selanjutnya. Di sini saya akan menjelaskan dulu tahapannya untuk akun LMS Pelataran Sehat. Di sini di sebelah pojok kiri atas ini ada tulisan progres belajar ya. Progres belajar di sini kan masih 0 ya. Jadi teman-teman harus progres belajarnya sampai nanti seminar ini selesai harus 100%. Jadi teman-teman harus berprogres sampai rating dan ulasan. Jadi kan di sini masih tulisannya 0/1, 0/1. Jadi diusahakan harus sampai 1/1 sampai rating dan ulasan nanti. Untuk evaluasi penyelenggara bisa teman-teman berikan rating 1-5. Untuk rating 1 itu untuk tidak baik dan ranking 5 itu sangat baik. Sampai nanti di rating dan ulasan juga sama, teman-teman bisa memberikan bintang dari bintang 1 sampai bintang 5, lalu nanti teman-teman bisa berikan ulasan. Seperti itu ya. Jadi setelah memberikan rating dan ulasan, akhiri seminar, nanti ditunggu sampai beberapa menit untuk sertifikatnya nanti. Nah, di bagian sini teman-teman bisa klik lagi bagian selanjutnya. intinya teman-teman bisa klik saja tombol berwarna hijau yang di sebelah sini, klik saja bagian selanjutnya. Nah, di sini teman-teman ada pretest, teman-teman boleh mengerjakannya. Untuk pretest ini ada 10 soal ya teman-teman ya. Jadi teman-teman bisa mengerjakan pretestnya, klik saja mulai kuisnya. Nah, di sini ada waktunya berjalan. Untuk pretestnya ini ada 20 menit. Kalau misalkan pretestnya tidak muncul seperti ini, teman-teman boleh refresh saja. Nanti akan muncul. Nah, seperti ini. Jika tidak muncul seperti tadi, seperti saya, tampilan pretestnya boleh teman-teman refresh saja, nanti klik lagi mulai kuisnya. Dan saya ingin mengingatkan untuk teman-teman menjawab pretestnya nanti itu diwajibkan mengeklik tombol selanjutnya, jangan mengeklik tombol angkanya. Karena kalau misalkan teman-teman mengeklik tombol angkanya nanti, jawaban teman-teman tidak akan tersimpan atau tidak akan tersave. Jadi teman-teman sudah menjawab sebanyak 10 soal. Ketika teman-teman mengeklik angka di sebelah sini, nanti jawaban teman-teman tidak akan tersimpan. Jadi diharuskan teman-teman mengeklik selanjutnya, seperti ini contoh. Nah, jika teman-teman sudah menjawabnya nanti, angka di sini akan berubah menjadi warna hijau. Lalu teman-teman klik saja selanjutnya. Dan di sini ada panel pretest dan selanjutnya di sini ada panel materi. Untuk materi, teman-teman bisa tunggu dulu selama 1 menit setiap per materi. Jadi jika di tombol sebelah sini belum berwarna hijau, masih berwarna abu-abu, teman-teman bisa menunggu dulu selama 1 menit dan waktunya akan jalan di sebelah sini. Jadi nanti waktunya akan jalan sebelah sini sama seperti pretest, cuman untuk materi waktunya hanya 1 menit saja. Jika teman-teman tidak bisa mengeklik tombol selanjutnya berwarna abu-abu, itu berarti waktunya masih berjalan. Jadi kalau misalkan teman-teman sudah selesai waktunya nanti tombolnya sama akan seperti ini berwarna hijau. Jadi nanti teman-teman bisa klik selanjutnya saja. Lalu nanti progresnya bisa akan berjalan di sini teman-teman. Oke. Mungkin tutorial dari saya secukup segitu dulu. Teman-teman ada yang kesulitan terkait ini, boleh nanti di-share saja di room chat Zoom biar saya bantu ya. Mungkin saya kembalikan kepada pembawa acara, izin.
Okay, thank you, Ms. Dea, for the materials. So the next session is discussion. All of the participants can ask the question using the raise hand feature or using the chat fields. You can use bahasa or in English. Untuk semua peserta yang ingin bertanya bisa menggunakan fitur angkat tangan atau menggunakan kolom chat. Untuk pertanyaan apakah videonya bisa di-share, kalian para peserta bisa melihat ulang videonya di live stream YouTube Poltekkes Tasikmalaya. Dan akan di-share. Baik, apakah ada pertanyaan berikutnya? Ya, ada pertanyaan, izin Kak, tadi sudah ikut pretest, tapi tanpa masuk ke pelataran sehat, Kalau seperti itu, apa diulang lagi?
Oke, saya izin menjawab ya Kak ya. Untuk itu pretestnya wajib juga dikerjain di pelataran sehatnya. Jadi kakak bisa melanjutkan saja pretest di pelataran sehatnya ya Kak ya.
Ya. Lalu pertanyaan selanjutnya, jika akunnya belum di ACC, bagaimana Kak?
Boleh tuliskan nama atau namanya saja, nanti saya dan tim akan membantu ACC-kan akunnya ya Kak.
Apabila yang menunggu verifikasi bagaimana Kak?
Sama Kak, boleh nanti namanya boleh diindikan saja nama-namanya siapa yang masih menunggu verifikasi. Nanti saya dan tim bantu verifikasikan hari ini Kak.
Baik, lalu selanjutnya ada yang bertanya, apakah tidak apa-apa terdapat tulisan profesi nakes Anda tidak sesuai dengan pembelajaran sehingga tidak akan mendapatkan SKP?
Oke, kalau itu karena dari sasaran pesertanya itu mungkin kakaknya ini profesi nakesnya tidak sesuai dengan sasaran pesertanya, jadi kakaknya masih bisa ikut seminar, cuman tidak bisa mendapatkan SKP seperti itu Kak.
Lalu pertanyaan berikutnya, untuk mahasiswa tidak perlu mendapatkan SKP. Oh ya, baik. Apakah ada pertanyaan berikutnya?
Saya izin menjawab ya Kak yang ada di kolom komen ya Kak ya.
Ya.
Untuk terkait kuis, bila tidak bisa mengklik selanjutnya, boleh di refresh saja karena emang sistemnya itu suka agak error. Jadi teman-teman kalau misalkan tidak bisa mengklik selanjutnya, boleh di refresh saja, nanti lanjutkan lagi menjawab pretestnya di akun LMS Pelataran Sehatnya.
Ya. Lalu ada pertanyaan, sudah dicoba login kembali tetapi muncul user tidak aktif, mohon konfirmasinya. Itu bagaimana Kak?
Oke, kalau muncul user tidak aktif itu karena peserta belum menautkan akun Kak. Boleh pesertanya menautkan akun dulu lewat emailnya, nanti bisa di emailnya memverifikasi akun kalau tidak salah Kak, seperti itu.
Tapi setelah dicek di email tidak ada muncul verifikasinya, itu bagaimana ya Kak?
Dipastikan untuk emailnya saat mencantumkan itu emailnya yang aktif Kak. Jadi kalau misalkan ada peserta yang mencantumkan akunnya tapi emailnya tidak aktif, kemungkinan email verifikasi akunnya tidak muncul ke email Kak. Dipastikan lagi emailnya email yang aktif agar nanti akan muncul notifikasi di emailnya, seperti itu Kak.
Oke, baik. Lalu maka dari sini saya akan tutup sesi tanya jawabnya karena sudah masuk ke jam narasumber berikutnya. Terima kasih Kak Dea untuk info lebih lanjut boleh chat. Untuk konfirmasi lebih lanjut kalian bisa chat di kontak person panitia seminar.
Terima kasih banyak Kak atas waktunya.
Yeah. Now we're Thank you for all the thank you for all the question. There is the end of material from Miss Dea. Thank you for your time. Now I'm giving it back to Miss Diana as the moderator for the next material session. For Miss Diana.
Yes, Aisha. Thank you so much.
You're welcome.
Okay, dear participants, we are going to the next second session. We are here to discuss about artificial intelligence application in biomedicine, opportunities, challenges, and solutions. It is my great pleasure to introduce our distinguished speaker today, Professor Emily Chiayusu, who brings a wealth of knowledge and experience in the field of big data and artificial intelligence.
So it's my time to share the screen, okay?
Yes, you can share your screen, Prof. But before that, I want to introduce your curriculum vitae first.
Sure.
The committee, can you share the curriculum vitae? Maybe Prof. Emily can stop share first.
Oh,
Yes.
okay. Okay.
Okay, here is the personal information and education, etc. about Professor Emily Chiayusu. She's working in Institute of Biomedical Informatics, National Yang Ming Chiao Tung University as a professor. And then the education, she got her bachelor degree, a Bachelor of Science from Department of Information and Computer Education at National Taiwan Normal University, and then she got her master degree, Magister of Science from Department of Computer Science and Information Engineering, National Taiwan University, and then she got her PhD from the Bioinformatics Program, Taiwan International Graduate Program, TIGP, Academia Sinica, in cooperation with Institute of Bioinformatics, National Chiao Tung University. And she has so many experiences, professor, Graduate Institute of Biomedical Informatics, Taipei Medical University from 2022 until 2024, and joint appointed professor professional master program in artificial intelligence in medicine in Taipei Medical University from 2022 until 2024. Also jointly appointed professor in Clinical Big Data Research Center, Taipei Medical University Hospital from 2022 until 2024. She is also was a director in Taiwan Association for Medical Informatics. Oh, still director from 2022 until present. And then she was associate professor in Graduate Institute of Biomedical Informatics from 2017 and 2022, and so many experiences. And her research interest is medical informatics, machine learning, clinical decision support, infodemiology, text mining, natural language processing, computational biology, structural bioinformatics, information retrieval or extraction, and immunoinformatics. She has so many published papers in reputable journal. Attached. Here we see so many. And then she also made letters to editors attached. And also technical reports, Chinese journal papers, and so many conference papers also attached. And her dissertation or thesis, she made on 2003 with the title Computer-Aided Construction of Curating Biomedical Databases, Extracting Evidence of Gene Expressions, Department of Computer Science and Information Engineering, National Taiwan University. And then on 2009, with the title Prediction of Subcellular Localization and RNA Binding Sites in Proteins, Bioinformatics Program, Taiwan International Graduate Program, Academia Sinica in cooperation with Institute of Bioinformatics, National Chiao Tung University. She also got received so many honors and awards. The first MOE Teaching Practice Research Program Awards, Excellent Program Awards 2023, Taipei Medical University, NSTC Undergraduate Student Research Project Excellence Mentor Award 2023, Certificate in EMI Skills by Cambridge English Language Assessment, EMI 2023, Taipei Medical University Mentor Teacher 2019 until present, and etc. So many. Attached. She also has so many professional activities. The first, the academic editor for journal, and then referee for journal attached, and then referee for conferences, and then program committee for conferences, and then so many invited talks. And others. Her computational skills are Python, R, SAS, C, C++, Java, Perl, PHP, Message Passing Interface, MPI Programming, Linux, MySQL, LaTeX. Okay. Now maybe Professor Emily, how are you?
Yeah, I'm good. So
Yeah.
I share my screen
Yes,
now.
you can
Okay,
share your
sure.
screen. Yes.
Sure.
And you can start your talk. Thank you.
Sure. My time is up to 11, I still got 30, 40 minutes.
Yes,
around.
yes, you still got, yes.
Okay.
You have like 40 minutes for talk
40
and
minutes.
then,
Sure.
yeah, and then 15 minutes for discussion.
Okay.
Thank you,
Sure.
Professor.
Okay. Okay. Thank you for your invitation. It's my honor to give a talk here at the fourth International Conference on Health Education and Technology, ICHET. So actually, I have been to Indonesia several years ago. I have been to Jakarta, Surabaya, and Malam. So I enjoy my stay there. Hopefully, I can visit you someday in person in the future. Yeah. So today I'm going to share with you a topic about artificial intelligence applications in biomedicine. I will talk about the opportunities, challenges, and solutions. Okay. So this is the outline of my talk today, and I will first introduce my topic, how to use artificial intelligence to help with biomedical research. And then I'm going to talk about several machine learning applications for health informatics. After that, I'm going to share with you several of my studies in terms of the research in bioinformatics, medical informatics, and info epidemiology. Okay, so first of all, although Ms. Diana already introduced me, but I would like to talk about my background a little bit. So when I was studying my bachelor degree, I focused on computer science. And when I studied my master degree, I began to work on a little bit about the bioinformatics. And when I pursued my PhD, I started to collaborate with biologists and do more multidisciplinary research. So after I joined my previous university, Taipei Medical University, which is a medical university, at that time I had many opportunities to collaborate with clinicians and medical doctors. So we propose more studies to solve the problem in the field of medical informatics. Besides that, in Taiwan, I also joined the Taiwan Association for Medical Informatics as Secretary General, and also now I'm still the director of the Taiwan Association for Medical Informatics. Starting from this October, I shifted to another university in Taiwan, NYCU. Now I work as a professor at the Institute of Biomedical Informatics. So before I begin, I would like to share with you today I'm going to talk about many applications of AI in the field of biomedicine. We know that AI has many aspects, including machine learning, natural language processing, speech recognition, like expert system, or how to do a good scheduling, research about robotics, and also computer vision. So I'm going to talk about a little bit about these, and then I'm going to use some examples to show you. So we know that the field of machine learning, it comes from the incorporation of data. So we need a good database system to be able to have a very organized data. After that, we still need to use some statistical approaches to examine whether our data is good enough to do our analysis. Finally, if we have a good data and then it's statistical important, then we can use machine learning algorithms to construct prediction models so that we can use these models to analyze the new data we are going to collect. So the reason why machine learning becomes very popular, it is because we have a huge amount of data. Besides that, the number of features or so-called dimension is very high, so that we cannot use traditional, for example, like a linear regression or traditional statistical approaches to analyze the data. Besides that, the data itself could be very different, and we need a better algorithm to be able to, for example, construct the prediction model or be able to analyze the data. So over here, we know that the process of data mining can be regarded as the knowledge discovery process in which we collect input data. After that, we may use data pre-processing technique to do, for example, feature selection, how to choose only the important variables to be used as input for your problem. Besides that, if we have too many variables, we may want to use dimension reduction approach to first reduce the number of features so that we can save the computational time or effort. If we have more data, we may want to use data sampling, or we want to do a normalization on the features itself. So if we can do a nice pre-processing before we jump into any data mining or machine learning algorithms, we may get a better results. So after that, usually if you want to publish a good journal paper, or if you want to propose a more significant study, you may want to focus on your post-processing, meaning that if you can filter patterns from your study, or if you can provide a better visualization of your result, or even you can interpret your results a little bit better, then this may become a good research with a more contributions in your field. So the process of converting raw data to the information, or so-called knowledge, is regarded as knowledge discovery process. So now, in the field of biomedicine, we see that there are many applications of machine learning, including we may use machine learning in the field of disease identification, or we want to propose a better way to do personalized medicine, or even we want to discover new drugs or do drug repurposing. Besides that, we may want to analyze EHR, electronic health record, or we want to predict epidemic outbreaks, for example, like COVID-19. So today I'm going to share with you three different aspects. I'm going to start with bioinformatics in terms of molecular level. After that, I'm going to move on to talk about more examples on medical informatics. Here we use individual patient level. We regard each patient as an individual to be able to propose some treatment suggestions, or we want to predict some diseases. After that, I'm going to move on to a larger scale in terms of the whole population. I'm going to share with you some of our studies on the public health informatics. So next, I'm going to get into the first part of my talk today, how to use machine learning technique to more basic research in terms of bioinformatics. So in bioinformatics, usually we look at the molecular level in terms of like genes, proteins, or RNAs, or microbiome, or other molecules. So here you can see that since my research involves in proteins more, so I focus on protein sequence analysis. You can see over here, this is a gram-negative bacteria. So in order to know the function or the structure of a protein, we need to know where the protein locates in a cell. So over here, you can see that the gram-negative bacteria, there are 5 different localizations or locations of the protein, including cytoplasm, the inside of a cell, inner membrane, outer membrane, and extracellular space. Between the two membranes, this location is called periplasm. So given only a protein sequence, we want to use machine learning algorithm to predict where the protein locates in a cell. So we use 2 different approaches to predict the location of the protein in a cell. The first one is based on a very biological method. Here you can see actually a protein was synthesized in the cytoplasm, and it got translocated to different locations through different bacteria secretory pathways. So over here you can see that proteins with different biological properties get to translocated to different locations. So we saw this biological pathway and think of a new idea. In the previous studies, many methods use the same variables to predict where the protein locates in a cell. So we come up with a new idea to use customized features to predict different location of the protein in a cell, including like solvent accessibility, signal peptide, transmembrane alpha helices, or translocated motifs, and many biological properties. So by using different biological properties to predict different locations of the protein, we come up with this new architecture called the PSL 101, in which different biological properties are incorporated into different machine learning algorithms. And we hope that by proposing this customized prediction method can achieve a better performance. So our experimental results demonstrated that, the idea that we get from the biological pathway is to propose customized features to predict different locations of the protein. It really worked. And we can see from our method compare with the other state-of-the-art method, we can see that we really improve the predictive performance a lot. So this demonstrated that by proposing a customized features for different machine learning algorithms, it really worked. However, based on the same question, that is, given a protein sequence composed by only 20 amino acids, we want to predict or we want to guess where this protein locates in a cell. Using the previous biological method to predict the location of the protein is not the only way. Instead, if we treat the protein sequence as a document and we want to classify what's the category of the protein in terms of the localization. So if you see any newspaper, for example, recently in the past week, Taiwan was experiencing a very strong typhoon, a hurricane. And if I see any like keywords related to typhoon or rainfall, or we may have some serious damage, then I can guess that this newspaper belongs to the weather category. So this is the same for the protein sequence. Over here, we don't know what's the category of the protein sequence because we didn't know the keyword of the protein or the terms. So here we invent a new way that is called a gap dipeptide to define the terms in a protein. So by using evolutionary information to score the terms in a protein, we further use a statistical method that is called probabilistic latent semantic analysis to reduce all the terms to different concepts to do feature reduction. So given the same research problem, that is, we have a protein sequence and we need to predict what's the localization of the protein. So using a different way of thinking, we treat protein as a document and we use some scoring method to score the terms in a protein. And after that, we use the terms to predict where the protein locates in a cell. So over here, we can know that, excuse me, let me plug my computer. Oh, okay, sorry about that. Okay, So given the location of the protein, we can also treat this problem as a document classification problem. So we also achieve a pretty good performance. Moreover, our second method can use visualization to look at what are the significant terms in terms of the 5 different localizations. Okay, so for the second part, I'm going to jump into a more individual patient level topic in medical informatics. So over here, I'm going to use the individual patient level as an example to show you some of our studies in the field of medical informatics. So first of all, I would like to share with you because some of my friends and the family members also have diabetics. So for diabetic patient, one of the most important question or concern that they should worry about is their eye problem. That is, some of the diabetic patients, they may have serious retinopathy problem in the eyes. So we want to know who are the patients that tend to have eye retinopathy problem for the diabetic patient. Therefore, we click clinical data from the hospital and use several machine learning algorithms to construct the prediction model to predict who would be the diabetic patients that tend to have retinopathy problem. So although we did a pretty good predictive performance, however, our paper got a very high citation because over here, as I just said, if you can do a good post-processing on your research data in terms of how to interpret your method, how to do a better visualization. So here, for our research outcome, we use a decision tree to share with the others about our finding, especially if you want to know whether a diabetic patient may tend to have eye retinopathy problem or not. First, our prediction method look at whether this patient already used insulin injection as his or her treatment or not. If he already used the insulin as the treatment, then yes, they tend to have eye retinopathy problem. However, if insulin has not been used as the treatment, then we further look at the duration of year. For example, if the patient already got diabetics for more than 7.5 years, then yes, the risk to have eye retinopathy problem also increase. If it is still less than 7.5 years, then it's okay. So for those patients who tend to have a high risk in the eye retinopathy problem, maybe the clinician should advise them to visit the eye clinic more often, for example, like 3 months or every 6 months, okay? So this is an example to share with you that nowadays, getting a very high predictive performance in the machine learning related research is not good enough. If you can further interpret your results a little bit better or be able to do a interpretable AI, then your study may have a better chance to be accepted in a higher ranked journal. Okay, so next I'm going to share with you another study about the in vitro fertilization. So in Taiwan, many couples in Taiwan, they want to have children, but they cannot. So they go to the clinic and do an IVF treatment. Here we collected about 70,000 data, and then we want to use machine learning algorithm to predict who are the mothers they tend to have pregnancy success in the IVF treatment, and what are the factors affecting their success rate. So over here, you can see that we collected several variables during the IVF treatment, including, for example, the cause of infertility, or what's the ovarian stimulation protocol, or whether the embryo, the eggs from frozen or fresh cycle. Okay, so we collected several variables related to IVF treatment. And over here, we construct different machine learning algorithms to predict the pregnancy success rate. You can see over here, our random forest prediction model predict pretty well with an AUC of 0.72. Besides that, you can see on the right-hand side, besides be able to accurately predict whether this mother would have pregnancy success or not, we further list the important variables related to the pregnancy success rate. Our first variable is ovarian stimulation protocol. Besides that, we also have the total embryo numbers, and also the female age is also a very important factor related to the pregnancy success rate. So we further want to look at what would be the propensity related to each variable. So you can see over here on the right-hand side, I would like to say that female age is a very important variable related to the pregnancy success rate in IVF treatment. So this figure, if you can see this line is above 0, it means that there is a better chance to have pregnancy success rate. If it is below 0, then it means that it is not easy to get a successful pregnancy in IVF treatment. We can observe that this line cross about at age 38 or 39. If female age is over age 38 or 39, it means that the chance to get a pregnancy success is very difficult in IVF treatment. Besides that, if you look at this figure tells you that the fresh cycle or frozen eggs, which one have a better chance to get pregnancy success. Before I do this analysis, I will assume that from the experience of many biological experiments, maybe having a fresh cycle eggs will increase the pregnancy success rate. However, the results turn out to be in the contrary with my hypothesis. Our result demonstrated that the frozen eggs have a higher chance to have pregnancy success rate, while the fresh eggs have a lower one. So this is a very interesting finding. We also look at the other medical journals and try to find out what is the reason to explain our finding. So the other study also talk about the finding that frozen embryos they perform better compared to the fresh cycles, because the frozen ones are usually taken while the mother was younger. Okay, meaning that maybe a mother, when she didn't want to have children, she froze her eggs in hospital, And when she wants to have children, she uses her frozen eggs to do the IVF treatment. This means that the frozen eggs are usually younger or have better quality compared to the fresh cycle. Okay, so our finding also have good uh, correspond well with other biomedical studies. So this is the reason why our result also show that frozen eggs have better pregnancy success rate compared to the fresh cycles. The other interesting variable is the age of the mother. So here we also find another clinical journal paper suggesting that uh, uh, the egg may have some chromosome problem. The chromosome problem will increase with age. So the chromosome problem, the rate is 10% in women aged less than 35. However, this rate will be increased to 30% at the age of 40, and even more when the age is greater than 45. Okay, so this demonstrated that why our results demonstrated that female age is a very important variable to influence the success rate of having IVF pregnancy. So besides that, we also do a medical image analysis to look at the chromosome quality of the embryo, and our study suggested that we can use the image to predict whether this embryo has a chromosome problem or not. So this is our website that we constructed for the women who want to predict their pregnancy success rate. So besides that, we also work on text mining to look at the psychiatric patient's medical record summary. This is an example of the medical summary. We use text mining to analyze the medical summary and want to identify the associations between the violent behavior and the other factors. So from our study, we can see that if the patient is, for example, male, and he is having an financial stress, then the probability to have violent behavior becomes higher. So these are the association rules we uh, extracted from the analysis from the text mining. Okay. So besides that, we also construct a add-on to identify different molecule names from PubMed. Okay. Finally, I still got 10 minutes to share with you our study in the field of public health. So in Taiwan, we have dengue fever, and many studies have been conducted in terms of weather vectors to predict the dengue fever. However, not many studies have investigated the relationships between air pollution and dengue fever. So here we collected the AQI, air quality index, besides the traditional variables related to dengue fever. So we can see that this is our statistical analysis. On the left-hand side, these are the days with dengue fever. On the right-hand side, these are without dengue fever. So if you look at the AQI variables, you can observe on the left-hand side and the right-hand side. The days without dengue fever, they tend to have higher AQI, higher air pollution. So by adding the air quality index into our prediction model, we slightly improve our predictive performance to predict dengue outbreak. This demonstrated that air pollution variables are useful for our analysis. If you further look at this figure, it means that the higher air quality pollution index, higher PM10, the less dengue fever. So this can explain by if the air quality is not good, PM10 or PM2.5 is high, it will affect the growth of mosquitoes. If the mosquitoes did not grow very well, we have less mosquitoes. In this case, we got less dengue fever outbreak. So this is the first study in Taiwan to look at the correlation between air pollution quality and the dengue fever. And our result also correspond well with other study in other countries in the world. So next, I'm going to share with you some of our serious studies related to the prediction of COVID-19. So these are our publications related to COVID-19 in the past few years. And first, we want to use Google search terms. There's a Google flu trend. If people go to Google and search for queries such as cough or where to buy medicine, or whether there's a flu trend, then in a few days later there is a outbreak of the flu. So this is similar for COVID-19. At very early stage of COVID-19, our group try to use Google search trends to predict the outbreak of COVID-19. This is the data from Taiwan, and we can see that back in December of 2019, nobody want to search for terms, for example, like coronavirus or COVID-19. But at the beginning of 2020, people started to learn about this disease from the newspaper or from other social media. So we can see there is a huge increase in the search term. So over here, you can see that people begin to search for where to buy facial mask in Taiwan. So we use these Google search terms to predict the correlation between the number of confirmed case or death cases in Taiwan. Besides that, our method can also do a visualization in which we got the urban area and we got the rural area. We can see that major cities, for example, like Taipei and New Taipei, they have a better correlation to search the COVID-19 related terms on the internet, while the rural area, they didn't have that kind of awareness for this disease with a lower correlation coefficient. So at that time, we also published the first COVID-19 paper in Taiwan on IJID, which is a very good infectious disease journal. And we collaborated with two excellent research from Indonesia, Athena and Anis. They analyze the data in Taiwan and be able to publish this paper. So we want to know what's the correlation between the search terms and the outbreak. However, we also collaborated with other research from like the Philippines, and here we propose a better public awareness to look at the influence towards like a social distancing and community quarantine. At that time, Taiwan didn't have that much confirmed cases or death cases. So therefore, we also collaborated with Professor Shin from the South Korea. At that time, the pandemic in South Korea is quite serious. So we try to analyze the data from South Korea and be able to correlate our Google search terms with 3 different peaks in the pandemic of South Korea. We can see that they are related to the local transmission or face mask shortage, or how to implement the coronavirus drive-through tests. So we can use the internet search terms to look at the correlations between these 3 different peaks. So we also discovered that in South Korea, the internet search terms may show a stronger correlation, especially in women and younger age groups. And also, we have a higher intensity in the affected areas. For example, like the major cities or the capital Seoul. Okay. So these are our findings in South Korea. Besides that, we also want to look at what are the hotspot and cold spot. Therefore, we use the data from the United States and use the several methods to look at the hotspot and cold spot in the United States. So as I just demonstrated that with a better visualization, your study may be published in a better journal. So from this video, we can see that this is February, March, April. We can see that the COVID-19 was transmitted into United States from the west part and slowly move on to the east part of United States, and after that it goes to the south and finally goes to the Midwest. So this video is a very important visualization to provide to the other researcher that we can analyze the progress or the transmission of COVID-19 in United States in a better visualization. So we also interpret the hotspot and cold spot in different states. So finally, we can also use our approach to predict different pandemic stages in South Korea. So we divide our data into 4 different subsets: 3 months after the outbreak, 6 months, 12 months, and 18 months. And from this figure, you can observe that our internet search terms have a higher correlation, especially during the early outbreaks of the pandemic. So the first subset is 3 months after the outbreak, 6 months. The longer the pandemic, like 12 months or 18 months, our method didn't perform that well compared to the early outbreak. Okay, so this is our finding in South Korea, and we also use different statistical methods to do the prediction method, and we also use a time series method to analyze our data and be able to propose an accurate prediction. Okay, so this is the end of my talk today. I think I use 40 minutes. So thank you for your attention. If you have any question, I would be happy to take some of the questions. Thank you.
Thank you so much, Professor Emily, for your very great talk. To the audience, if you have any questions, you can raise your hand, or you can also send your questions to the chat room. Okay, maybe Professor, there is a question from me. Okay, when implementing the AI solutions in biomedicine, what are some of the key challenges related to data quality and availability? And how do we overcome these obstacles to ensure reliable AI outcomes? Thank you.
Okay, thank you, Diana. That's a very good question. Actually, before we do any analysis, not only in the field of AI or machine learning, we need to make sure that our data is representative enough to answer our research question. So we can make sure that the variables we collected can be used for our research question. Besides that, the amount of data is also very important if you want to do a machine learning or AI analysis. Suppose you just have like 20 or 30 samples, then maybe this number is too small to do a machine learning analysis. However, if someone may ask me whether there is a fixed number to do a machine learning analysis, of course, the bigger the better. The more data you have, you will have more uh, uh, way to analyze your data. You can do like a data filtering to rule out the outliers, or you can drop those data with not so good quality. So the more the better. However, some of the research questions they got their limitation in the number of data. For example, if you are looking at a rare disease problem, the number of cases is not so many. So we also have other machine learning uh, techniques to deal with imbalanced data or this kind of question. So in summary, we need to make sure that our data quality is good enough. You collected all the variables related to your research problem so that you can have enough information to construct the machine learning model you want to predict the outcome. Yeah, I think data quality is the most important. And also data volume is also an important factor related to the field of machine learning. Thank you.
Thank you so much, Professor. To the audience, do you have any questions? Maybe your material is too too good, Professor. So, okay, maybe I will ask again. What do you see as the biggest ethical challenges? Because I saw that you are talking about the biology. So, what is the biggest ethical challenges in applying artificial intelligence to biomedicine? And how can we ensure that AI-driven solutions are both safe and equitable for all patients? Yeah. Regarding maybe
Yeah.
to the patients, yes.
Yes, that's a very important and also challenging question. Here in Taiwan, people are beginning to aware about the application of AI in the field of biomedicine. However, as Ms. Diana just said, how to make sure that our AI prediction model can be applied on patients and to make sure that it's safe and okay to intervene with the treatment. So nowadays in Taiwan, we need to go through the government to make sure that we follow the regulation to apply AI on the patients. We need to apply for the license, and after you got the license, of course, the license must be screened and must be reviewed by the government to make sure that this kind of AI generated model can be used to suggest the treatment or to intervene with the treatment in the patients. So, in summary, in Taiwan, we try to make laws for this kind of application of machine learning when we want to use the models on patients in the hospital.
Yeah, thank you so much. Okay, I will check from the chat room. Okay, there is a question from Rahmawati, one of our student professor. She asked, what are the main challenges in applying protein subcellular localization or PSL predictions in the field of bioinformatics? Yeah.
Okay, thank you for your question. This is related to bioinformatics. Actually, the main challenges would be because the previous example I show is on the field of gram-negative bacteria, which only has 5 different localizations. However, as far as I know, as we know, the other like eukaryotic cells, for example, like yeast cell or like animal cell, they have more localizations. The more localization, it means that it is more difficult for the machine learning algorithms to predict the localization. So the previous example I showed, gram-negative bacteria only have 5 localizations. For machine learning algorithm to predict one of the 5, it is easier. For example, like the yeast cell that I talk about, there are 22 localizations. So for the machine learning algorithm to predict one correctly from the 22, it becomes more and more challenging. So that's the first challenge that I talk about. If we have more complex cell that we need to predict, the accuracy might drop. The other question is that we need to collect more data for different type of cells. We base on the experimental approach to validate the true localization of the protein. So this means that if we want to accurately predict the location of different proteins in different cells, we need to have more wet lab validated data. So we need to collect more data from the experiments. Yeah, so these are the two challenges that in the field of PSL prediction need to customize the localization in different cells. The other challenge is to get more experimentally validated data so that we can construct our model. Thank you.
Okay, thank you. We still have several questions,
Sure.
Professor. Yes, this is the question from Salsa Nur Adila. What are the major challenges developing countries face in implementing electronic medical records? Because the challenges in developing countries and developed countries will naturally differ. And what practical solutions can address these issues? Okay.
Okay. And there's another one before that. Do we need to answer one by one or we can jump? There's another one by Desfiana.
Desfiana. Okay.
Mm-hmm. Do
Oh,
we?
okay.
Yeah.
Yes, yeah. What is the role of machine learning in improving early disease detection, and what are the challenges in the application of AI in biomedicine?
Okay. So we can first talk about this one before we answer the other one. Okay, the role of machine learning in improving early disease detection. So over here, I think it's very important. We want to do disease prevention. Before we get the disease, if we can have another way to prevent it, then we can do that. So this is the example that I showed. For example, like the diabetics retinopathy problem. Before the eye problem gets worse, we can consult with the doctor more often to prevent the disease or prevent the severity of the disease. So I think this is the most important role in the disease prevention. We can either prevent the disease itself, or if we cannot prevent the disease, we can reduce the severity of the disease. I think that's a major role of disease prevention in the field of AI. As for the challenges of application of AI in biomedicine, I think one of the major challenge is that many like treatments or like the examination is quite expensive. Therefore, in the field of machine learning, in order to achieve a better predictive performance or accuracy, we need to have more data. However, for some kind of treatment, for example, if you want to use target therapy to treat your cancer, but the treatment is quite expensive. Therefore, we need to have more data to be able to achieve a better accuracy. I think the major challenge is on the data volume and also the data quality. Even if we have enough data, we still need to do a good preprocessing to rule out those data with a bad quality. Besides that, I think the technical part is quite advanced right now. We got a lot of algorithms in the field of machine learning, deep learning, or even image processing. We got huge advance in the field of computational computer science. So I think given a good quality of data, and also if the clinicians they are willing to share their data with the public, or in Taiwan, this is the same. We try to set up more facilities or medical centers to collect more representative data from multi-center study. So this can accumulate more data so that we can do a better research. Yeah. So let's hopefully I answer this question. Okay, the next one, the major challenge developing countries faced in implementing EHR. This one, okay?
Yes.
Okay. Okay. So in developing EHR, I think here the first one is that here nowadays in Taiwan, first of all, we need to make sure that the EHR, whether there is
Professor.
a debate. Yeah.
Professor, maybe to describe the Indonesian condition that we still not have the EHR for now, but we are concentrate to build the EMR for each healthcare from 2022 until now.
Okay.
So that's, yeah.
Yeah. I think if you can collect the EHR or EMR, you can begin to accumulate your data, and you can let the patient to sign the consent form to share with share your EHR with academic use, because there is a problem of in debate in Taiwan. Some people are saying that the EHR belongs to uh, their personal medical record, and they refuse to share their medical record with the public, even though it is for academic use. Yeah. So I think it's a very important uh, concept to the government to be able to share with the public that sharing the EHR with de-identified information, meaning that your ID or your personal information will not be revealed when your data is released for like academic use or to become like a national health insurance data set. So it's a very important uh, aspect and also very challenging question. This is the same in Taiwan because not not everyone accept to have their medical record, even it is de-identified. Some people think that they are not willing to share their uh, medical record with the others. However, if we want to do a good research or we want to have a national cohort, this is necessary to do so. And we need to make sure that after the identification, your identity will not be revealed after they process the data properly. Yeah. Okay, back to Diana.
Okay, thank you, Prof.
Mm-hmm.
Let me check. We still have time, maybe around 5 minutes.
Sure.
Okay. I think there is no question more.
Okay.
Yes. But maybe one more question from me, Professor.
Okay.
With the rapid advancement in AI,
Mm-hmm.
how do you think AI will impact the role of the healthcare professionals in the future? Will it complement their work, or is there a concern that it might replace certain aspects of clinical decision making? Yeah, sometimes people afraid to lose the job.
Okay. That's a very good question, and I think many people are afraid that they may get easily replaced by AI. However, I think AI is still like a facilitated role in the medical aspect. The AI can provide information for the medical doctor to make a better decision. However, to do a treatment or if you want to subscribe some drugs, you think I think even here in Taiwan we need to use human intelligence to do that. Also known as we need to have humans to do that. So no matter how the development of AI, the role of AI is to help the clinical medical decision support, but it will not replace the human itself. So, for example, like nowadays, Chat GPT is very popular, especially my students, they use Chat GPT to do their assignments. However, if you look closely, even a very good AI like Chat GPT, they still make mistakes. So I think up to now, the role of AI is only to help us to make a better decision, but it doesn't mean that we can be replaced by AI. Yeah.
Okay, thank you. Oh, there is one question from my student,
Sure.
Safiatul Kamilah.
Mm-hmm.
She asked, how about the medical record in Taiwan, the condition? Is there already electronic, all the things there? Or is there
Yes.
still manual?
In most of major hospitals in Taiwan, we use EHR. So EHR is very popular in the major hospitals. And even though on our personal cell phone, we have an app to look at our EHR. If I go to uh, hospital A and hospital B, I can see the results or some lab examination data from my cell phone. Okay, so it's very popular. But for some very small clinics in Taiwan, for example, they got their own like a private system, or they got their like even written medical charts. Okay, but I would say that for major hospitals in Taiwan, we use EHR very frequently. Yeah, most we have our image or lab exam data or some written medical summary or online. We don't use papers anymore in the major hospitals.
Yeah, yeah. It's very convenient to live in Taiwan, actually.
Yeah.
Yeah. Thank you, Prof. I think maybe we are going to close this session because there is no more questions anymore, Professor.
Sure.
But a little bit conclusions. Maybe Professor already talked about the applications of machine learning in health informatics, about disease identification or diagnosis, about personalized medicine or behavioral modification, and drug discovery or manufacturing, clinical trial research, radiology and radiotherapy, smart electronic health records, and epidemic outbreak prediction. And thank you very much for your very great talk today, Professor. And before we close, let us give you the certificate first.
Thank you. It's my honor to be here.
Thank you so much. Okay, here is the certificate for our distinguished speaker today, Professor Emily. The committee maybe can open the certificate, please. For Professor Emily, sorry. For the Professor Emily. Is okay?
Yeah, it's a correct one.
Yeah.
Thank
This
you.
one
Thank
is
you so
correct.
much.
Yeah, thank you. Later we will send directly to you.
Sure.
Okay.
Sure.
Thank you so much, and see you next time.
Yeah, thank you. Yeah, hopefully I can visit you someday in person.
Yeah, hopefully.
Hopefully.
But I just want to give the description about our place. Actually, our place is there is no airport in our place. So from Jakarta, we need like travel by train around 7 hours to here to be
Wow,
here.
wow.
Yes.
That's
So
not easy
yeah,
to get there.
yeah, not easy to reach here. But our institution
Yeah.
is under the Ministry of Health. Yeah.
Sure, sure.
Yeah,
Yeah. So
that's
maybe
why
virtual conference is
yeah, better.
more convenient.
Yeah, more convenient because you
Yeah.
need to reach like 7 hours from Jakarta.
Oh, wow, wow.
Yeah. Okay, thank you so much, Professor.
You're welcome.
Hopefully
Yeah, it's my
next time
pleasure.
you you still want to be as our distinguished speaker next
Sure,
time.
no problem. Anytime.
Okay.
Yeah.
Okay, thank you. Bye bye, Prof.
Thank you. Bye-bye. Bye-bye.
Okay. Okay, and the second session has been closed, so I deliver again this microphone to Master of Ceremony, Aisyah. Where are you, Aisyah?
Okay, thank you, Miss Diana. And to the participant, please be able to do the post test. All participants are required to do the post test and screenshot for attendance purpose. For the post test, please fill out the post test of the LMS that charging time for 10 minutes.
I said I love the Smiths. You've produced music. I love the Smiths. I said I love the Smiths. You've produced music.
Thank you for the participant who have completed the post-test. For the participant who scored below 60, can do the test again. I'm sorry. To all the participants who scored below 60, can redo the test until the score is above 60. And now I will mention the best pretest and the best post-test result. The best pretest result achieved by the first is Shalsha Zaskia Rahayu, Poltekkes Kemenkes Tasikmalaya, Sahya Amanda JK, Poltekkes Kemenkes Tasikmalaya, Gilang Setyo Nugroho, Poltekkes Kemenkes Tasikmalaya, and then the best post-test result achieved by Anissa Fatimatu Zahro, Poltekkes Kemenkes Tasikmalaya, Najwa Salsabila Azahra, Poltekkes Kemenkes Tasikmalaya, Syahara Inayati Afita, Poltekkes Kemenkes Tasikmalaya, Wilayah Cirebon. Once again, I mentioned participant who scored below 60 can redo the test until the score is 60 above. Untuk semua peserta yang nilainya di bawah 60 bisa melakukan tes ulang hingga skor mencapai 60. Congratulations in achievement. The winner will be contacted by our contact person. Now we will praying together. Turandi, time is yours.
Before we end the event, let's take a moment to pray that the knowledge that has been conveyed will be useful. I will lead prayer in accordance with Islamic tradition, and I respectfully ask people of other religion to conform to their own belief and belief. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin, hamdan syakirin, hamdan naimin, hamdan yuafi ni'amahu wa yukafi mazidah. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhikal karimi adhini sultanik. Allahumma salli wa sallim ala sayyidina Muhammad wa ala ali sayyidina Muhammad. Allahumma inna nas'aluka salamatan fid din wa afiatan fil jasad wa ziyadatan fil ilmi wa barakatan fil rizki wa taubatan qoblal maut wa rahmatan indal maut wa magfiratan ba'dal maut. Allahumma hawin alaina fi sakaratil maut wan nazata minan nar wal afwa indal hisab. Rabbana dhallamna anfusana wa illam taghfir lana wa tarhamna lanakunanna minal khasirin. Rabbana la tuzigh qulubana ba'da idh hadaytana wa hab lana min ladunka rahmah innaka antal wahhab. Rabbana hab lana min azwajina wa dzurriyyatina qurrata ayun waj'alna lil muttaqina imama. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Subhana rabbika rabbil izzati amma yasifun wa salamun alal mursalin walhamdulillahi rabbil alamin. Wassalamualaikum warahmatullahi wabarakatuh.
Doesn't feel we're on the last agenda. Hopefully what the speaker convey is electronic medical record, medical billing, and big data We can understand and apply them well both during lecture and in the world of work. I am Aisyah Sinta. Thank you to all relevant parties who have been willing to attend the seminar. Thank you to the seminar supporters and apologize if there's any mistake. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. See you in the next seminar.